Well, good morning. How is everybody doing? Hey. Well, we welcome you to our single-payer healthcare town hall on behalf of our co-hosts of this important meeting today, Assemblymember Mark Levine, Senator Ricardo Lara, and the chair of the Marin County. Let's give him a round of applause. Come on now. And the chair of the Marin County Board of Supervisors, Judy Arnold. We are so grateful, absolutely. We are so grateful that you would take your Saturday morning to be with us. We have an all-star lineup of speakers today who we're going to be introducing shortly. But first, we'd like to be able to get into a few housekeeping items. The water and goodies, along with the coffee. If you need a caffeine fix, it is to my right into the back. We welcome you at any time. Refreshments will be passed out in just a bit. We are going to want to hear from you today. Comment cards for anyone interested in writing or sharing their comments, questions, or concerns are available at the check-in table. And we're also going to start passing out comment cards shortly, and we encourage you to fill them out. In addition, we are going to want you, if you'd like to be able to speak, to come to this microphone under the public forum, and each individual who would like to be able to speak today will be given 1 minute. Know that there are a lot of individuals who are going to want to speak, which is why we have a time limit. In addition, the most important part of this town hall is hearing from all of you here today, which is why each of the speakers are going to have either a 5-minute or a 3-minute capped time limit, and then we're going to turn it over to all of you, which again is the most important part of today's town hall. I hope that you are going to agree with me. Healthcare in America is a right, and it must no longer be a privilege. And that is why I am proud to co-author with Senator Lara Senate Bill 562, which is California's single-payer healthcare legislation. And since the adoption of the Affordable Care Act in 2013, California has dropped its uninsured rate to a historical low. 3.2 million Californians and tens of millions from across this country have access to health care for the first time. And according to Consumer Reports, bankruptcies related to unpaid medical bills have dropped in half since 2013. Absolutely. President Trump is wrong. He is wrong when he says the Affordable Care Act is failing. We know, just like California's economy, the ACA is thriving. That said, the president and many in Congress are hell-bent at repealing the ACA, which is going to leave millions of our states most vulnerable on the brink. The latest revision of the ACA by the United States Senate would increase individual costs by an average of $2,800 per year per patient and give the richest families in the country a multi-million-dollar tax break, which is simply unacceptable, and enough is enough. With the national healthcare system under attack, the time has come for California to advance the critical conversation and, yes, debate about single-payer healthcare. Senate Bill 562, the single-payer healthcare legislation in California, would transfer healthcare services to a publicly run plan that will cover every resident in California. We spend $3 trillion on healthcare in America every year. And despite America being one of the richest countries in the world, we devote more of our gross domestic product to health care. And what does this get us? It gets us one of the worst rankings of all industrialized nations when it comes to health care outcomes. The World Health Organization ranks the U.S. 37th on the planet for positive health outcomes. We're 39th in infant mortality and 36th for life expectancy. We know that we can do better, and we must do better for patients and taxpayers. Over the past few weeks, as you all know, Senate Bill 562, the bill that has been advancing, has stalled. And candidly, there has been a lot of finger pointing over the last few weeks about the reasons for this. But that's not why we are here today. As North Bay residents, members of the State Senate and State Assembly, and members of local government, healthcare professionals, and business owners, we've come together today to move the conversation forward. To come together because it's a priority, I think, for all of us in this gym to get this bill, and yes, this important debate and discussion about 562 back on track. Are you with me, ladies and gentlemen? We're going to want to hear from you about the priorities for this bill, what you want most in a healthcare system. We're also going to want to hear your concerns. Today's call to action is all about receiving your feedback in just a few moments. Again, thank you so much, all of you, for coming out today on your Saturday morning to join us. It's now my pleasure to be able to introduce your Assembly member and co-host of this town hall, and I might add, the only Assembly member in the state of California that is hosting a town hall on single payer. Let's give a warm welcome to Assemblyman Mark Levine.
Thank you very much, Senator McGuire. Thank you to everyone who is taking time out on a Saturday morning to join us for this incredibly important conversation, and one of the most important conversations we're going to be having this year. Access to quality, affordable health care must be recognized as the right of all Californians. There should be no obstacle to the medicine, treatment, or surgery necessary to keep healthy. And we must together work to forge a path to universal health care that works for everyone. Just this week, I had a forum in Petaluma, and the room was fuller. I've been in Petaluma, and I've done a number of community forums there. The room was as full as I had ever seen it, and I remarked to them that something happened in November that changed the whole dynamic of how we engage in public discourse and come together to talk about the challenges our community faces. And they all chuckled a little bit because we all know what triggered that, and it was the election of Donald Trump. And thank you, that's right. So what the challenge we face with healthcare is that we now have a united president and Congress hell-bent on taking healthcare away from Americans. They are hell-bent on taking it away from Californians. And we have a lot to protect, and I'll tell you why. And it was frightening when I learned this. Half of California's children are on Medi-Cal. A third of all Californians are on Medi-Cal. There are lives at risk. This isn't just a vague national story, and we can drill down just to Marin, the 47,000 people on Medi-Cal and the 56,000 people on Medicare, that these are real people, our friends and neighbors, that depend on health care, that we have people in Washington trying to take away. But what we have here before you are both lawmakers and policy experts that are also equally hell-bent on protecting people's access to health care, making sure that everyone is covered, making sure that if single payer is the path forward to make sure that we can protect everyone, that we can do it for everyone in California. And this is the conversation we're having. So thank you for being a part of it. Thank you, Senator Lara, for joining us. You're joining Senator McGuire and me up here in our district to engage our constituents in this conversation. We're grateful to have your leadership on this issue, and I look forward to hearing your comments. That is extraordinarily informative for us to be armed with how you feel when we go to Sacramento and cast votes on your behalf. So thank you for being a part of that conversation.
Thank you so much, Assemblymember. We are so grateful to be able to have the good senator from the great city of Los Angeles. He has been out on front on this bill, ensuring that all Californians have access to quality health care Ladies and gentlemen, let's give the lead and joint author of Senate Bill 562 a warm Marin welcome. Ladies and gentlemen, Senator Ricardo Lara.
Thank you. Buenos dias. It's great to be here in Marin with all of you. Thank you to my good colleague, Senator Mike McGuire, my good colleague from the Assembly, Senator Mark Levine, for inviting me to be here and having the courage to have a dialogue with our community about the great need for health care now more than ever as President Trump works to dismantle it for so many hardworking Americans. And let me tell you, the minute I started talking about the need for us to once and for all have a public option, a universal healthcare option, Mark Levine and Mike McGuire were the first to sign up and say, let's get this done. So those are the type of representatives you have representing you in Sacramento. I want to start by simply just, explaining a bit about me and why I came to this decision. I have worked for years in the legislature to ensure that our most vulnerable had access to health care, our immigrants, our working families, our seniors. And it took me 3 years, but we were able to accomplish something that was unprecedented here in California, and that is ensuring that every child, regardless of their immigration status, have access to full-scope Medi-Cal. We were able to accomplish that, and now to date, we have over 250,000 children in California who are now enrolled that would otherwise not have any access to any type of care. And I tell you this because I grew up in East Los Angeles as a child of 2 undocumented immigrants who for the first 15 years of my life did not have any type of health care. Health care for me was driving south of the border, was coming up with home remedies, was trying to figure out what we were going to do when one of our parents got sick or when one of my siblings and I got sick. So this is something that's very near and dear to my heart and something that should not be happening in the most powerful country in the union and the most powerful state of the union, I should say. And this is why now more than ever, we have to double down our efforts to ensure that everyone has access to health care, regardless of your income, regardless of your zip code, regardless of your immigration status. We are California. We lead. We set the trend. We show how it's done. We've done it in every aspect of our policy making. We've done it in education. We've done it with the world's best universities. We've done it in our environmental policies. It is time that we send a message to Washington, D.C., that while you try to limit care, we're going to double down and actually expand care for everyone. And so I'm going to go very quickly with some slides that we'll have available for you here to look at after, but I wanted just to talk about SB 562 and some of the key tenets of what we're working on. 3 major tenets that we think are fundamental to any universal health care bill. And I call it universal health care because I'll tell you, outside of this gym, no one in California has any idea what single payer means. They think, I'm the payer? Who's the single payer? I'm single. Do I pay? What is happening? And so I need your help from today moving on forward to talking about universal health care. Access to ensuring everybody has access to care, Medicaid, Medi-Cal for all. That is what people understand and people are able to grasp as opposed to a single payer system. So I need your help with that moving forward. But the 3 key tenets of our legislation is ensuring that healthcare is a human right, ensuring that you get to pick your doctor, not your health insurance, and that we put clinicians, doctors, and healthcare professionals in charge of your care, determining what is the best care that you need, not somebody on a computer determining when you cannot get access to a specialist, to a treatment, or to the type of care that you've been asked to take from your hospital and your doctor. Your doctor now is in control of your care. We want to make sure there's no more out of control copays and high deductibles, no more plan switching or guesswork when insurance rates or plans change, and no more decisions made in secret by health insurance companies. Those are fundamental tenets for our legislation. And as we move to have this discussion, I want to put it in context in terms of what it looks like in the state of California. We know that 45% of our insurance is paid by employer paid, 38% is Medi-Cal or Medicare, and 9% is the individual market, still leaving roughly around 8% people uninsured. That is a tremendous achievement that we were able to accomplish with the Affordable Care Act. Our perspective is, let's build on the Affordable Care Act and allow us to then fully now cover everyone that remains uninsured under our current system. We know that Californians, and in particular in the United States, we continue to pay more for care and get less without any other healthier outcomes. We know that we in the US have the highest per person healthcare cost, roughly $10,000 per family. And this is already with your insurance, to say. So we want to make sure that under the Healthy California Act, or SB 562, that we expand coverage to the 3 million uninsured Californians, that we fully cover the 33% of Californians who are currently underinsured, and that we cut copays and deductibles. Now, those are significant targets, but we also know under a public universal healthcare system that there's substantial savings, which we're trying to tell the media is that you're missing the whole point on, is we save on administrative savings, we get to negotiate drug prices, which, by the way, I was just in Canada a couple months ago, where they're saying that it's outrageous what we pay here. We pay 5 times the amount for our drugs, which ironically are being manufactured, a lot of them in this area alone. So, and we want to make sure we get more effective services and better prevention. So we're not starting, everybody got scared when we talked about this $400 billion price tag. But what we fail to recognize is that we're currently spending $368 billion already annually. So we're not starting from 0 to 400. We actually now have a plan to actually scale that down and be able to create a program that's sustainable. Because the last thing we want to do is put together a universal healthcare system that is not going to be sustainable for the future, and that's going to have significant cost controls so that then we can be able to sustain the program. Those were the 2 lessons that we learned on our Canada trip, was ensuring that they told us you want to make sure that it's sustainable and that you have appropriate cost measures that are able to allow you to have a program that's going to sustain for the long term. Thank you. 1 minute. And so what we're currently actually saying is under our program, we would actually cut money and our saving and actually be spending $331 billion. So that's a reduction from what we're currently spending now. So lastly, I want to go to the next steps because I know many of you have these questions and I want to just get to this. So there's a 3-pronged strategy for this and what we're going to need to set the perspective for your questions. The healthcare policy, which was voted on by the Senate and approved and now in the Senate, is the one that is the majority vote of the legislature, which just sets the policy framework for the bill. The number 2 is the funding plan for this. Once the funding plan, and we have several funding plans out there that are being looked upon, that is a 2/3 vote of the legislature that still has to go back to both houses. Third is we're looking at what the requirements are for a statewide ballot initiative. We need to amend the Constitution because currently our Prop 98 requires that any new revenues that are raised have to go, half of that has to go to our public schools. So we need to go back to the voters and let them know that the new money is being generated will have to go to healthcare and not to the public school system. We also have a state spending limit that has to be abided by, which we need to now amend through a vote of the people to be able to get this done. So those are the 3 strategies and 3 things that we need to look at, along with the federal waivers that we need to get to be able to fold in Medicare, Medi-Cal, and the Affordable Care Act into our new system. Now, those waivers are very important and why 4 years from now, we all need to do a better job of getting out there and electing a new president, because under this president, we don't think we're going to be able to get these federal waivers, and there is no judicial avenue for us to be able to force the federal government to do that. So those is just to give you a perspective, an overall perspective, and give you some insight as you formulate your questions. I look forward to speaking to you all today, and thank you for inviting me to be part of this important discussion.
Thank you so much, Senator Ricardo Lara. We're grateful that you're here. Ladies and gentlemen, the final individual who's going to be speaking on our panel is the president of the Marin County Board of Supervisors. And I want to say thank you to Supervisor Arnold. She and the Board of Supervisors have been out in front on this important issue when it comes to universal health care here in Marin County for many years. And Supervisor Arnold has been a true champion. We also want to recognize we have Supervisor Rodoni from West Marin here today. And so without further ado, there's Supervisor Rodoni. Let's give him a round of applause. Thank you so much. Without further ado, it is now our pleasure to be able to introduce the president of the Marin County Board of Supervisors, Supervisor Judy Arnold.
Thank you. Thank you, everyone, for coming. This is a great crowd to see, and thank you, Senator McGuire, for organizing this forum today. Healthcare is one of the top concerns in the United States. And President Obama and Speaker Pelosi did a great service to us besides drafting Obamacare. And that is that the majority of people in our country now believe that health care is a right, and that's huge. Under the Trump administration's back and forth threats and challenges, it is time for California to stand up and be counted as one state that answers the challenge and bring in a single-payer health program for everyone in our state. Our Board of Supervisors was very happy to support Senator Lara's bill, SB 562. I hope you read the letter that we sent you from the board. The Healthy California Act. This ensures just this, that every resident of California will receive comprehensive health care. That's the perfect bill, and it's the bill that's needed right now in this country, and California can show them how to do it. In other words, a single-payer system that folds in the Affordable Care Act in a manner that is financially sustainable. What isn't sustainable is the approximately $100 million in Marin federal health care dollars that will be lost to our state and our county from the repeal of the current plan. We cannot let that happen. So let's do all that we can to move Senator Lara's bill to the Assembly and on to the governor. Today is a great beginning. Thank you.
Thank you so much, Madam Chair. We're grateful. Thank you so much to Assemblymember, Senator, and the Supervisor for all co-hosting today's forum. And again, thank you all for being here. I want to remind you, if you have a question that you'd like to be able to ask and you've written on your comment card, feel free to just raise that comment card and we're going to come collect it from you. We're also going to be passing comment cards out as well right now on both sides of the gym and in the middle. It is now our pleasure to be able to transition to our panel of experts. We have individuals who represent in public health, small business. We have nurses and doctors, all focus on moving single-payer universal health care forward. And each individual will be given 3 minutes. I'll give each of our panelists a 30-second prompt, not trying to be pushy, but wanting to make sure that we leave plenty of time, the majority of time for all of you, your questions, comments, and concerns. Our first panelist is Dr. Grant Colfax. Dr. Colfax is the Marin County Health and Human Services Director and has been working in public health for over 20 years now. He worked as President Obama's top AIDS policy advisor from 2012 to 2014. Mr. Colfax is going to be focused on why single payer is important to the public health for all residents in the County of Marin. Let's give him a warm welcome. Dr. Colfax, we're grateful you're here.
Well, good morning, everybody. Thank you, Senator. Thank you, everybody, for being here. I have a question for people in the audience. How many people are getting Medicare right now? Raise your hand.
Wow.
Yeah, a lot of people, right? It works pretty well. Works pretty well, right? It's an amazing system. Let's get Medicare for all. That's what universal health care coverage is about. It's not that hard, right? Universal care, Medicare for all, there's the sign. So what does this mean for Marin? And I like to think about framing this from the perspective of where we've been and where we're going. Obamacare was a big step forward. It made things a lot better. As you heard earlier, it really helped insure millions of people across the United States and actually tens of thousands of people here in Marin. Key step forward, Medicare for all is better. Medicare for all will help us address the still challenges that we have both as a nation and locally with regard to insurance coverage. The House bill to repeal Obamacare is bad. The Senate bill to repeal Obamacare is worse. Couple of key things. Medicaid. The Congressional Budget Office estimates that Medicaid spending by 2036 will drop by an astounding 36%. 36% cut. That's the end of the safety net for federal support. There's no way state or local governments can make up that difference. That will have huge impact on Marin. Medicaid pays nationwide for 2/3 of people in nursing homes. How are we going to make that up? What does that look like going forward? So again, Medicare for all is the solution going forward. Obamacare made things better. Medicare for all is best. With regard to Marin, about 8% of people in Marin County are still uninsured despite Obamacare efforts. And about a third, as the Senator was saying, reflective of California, about a third are underinsured. And we know that things like copays, high deductibles, are barriers to care. So being covered is necessary, but it's not sufficient. If you have to go in, even what some people would consider a relatively small copay for your pharmaceuticals, for seeing the doc, for seeing the specialist, it's a big barrier to care, especially for our low-income families. So we've certainly made a lot of progress in Marin. We've halved the rate of uninsured people because of Obamacare, but we really need to get better with regard to covering everybody, and for those folks who are uninsured, doing better. Medicare for all is really the answer.
30 seconds.
As the Senator was saying, we're ranked in the mid-30s for our healthcare outcomes. Nations that have universal access have better health outcomes. Medicare for all makes sense from a medical outcomes perspective. It makes sense from a financial perspective. It makes sense from an administrative perspective. It's really a political question. And the question is, as a state, as a county, do we have the will to move Medicare for all forward? And I'm confident with the leadership in this room we do. Thank you.
Thank you, Dr. Colfax. Grateful for all your work here in Marin County. We're now honored to be able to introduce Dr. Jim Kahn. Dr. Kahn is a professor of health policy and global health at the University of California, San Francisco, where he also chairs the UCSF Research Administration Board. His research, which is why we have him here today, is focused on estimating the costs of prevention, treatment, and care interventions, as well as cost effectiveness when it comes to health. He has been an informal advisor to the financial study that was advanced by the University of Massachusetts, focused on California's universal healthcare plan. He's going to be talking about the costs and benefits of a single-payer healthcare plan. Doctor, we're grateful that you're here. Let's give a warm welcome to Dr. Kahn.
Thank you, Senator. It's a real honor to be here and participate this morning. More, better, fairer, cheaper. As a practicing economist, I never get to say those words in the same sentence. It's usually about how much more do we have to spend to get some improved health care, but really single payer is a unique opportunity where we can get more health care of higher quality that's more fairly, the burden of which is more fairly shared, and it saves us money. This is the important message. Single payer from a technical standpoint is a really easy problem in health economics. Basically, you take what we're spending now, which includes about 15% inefficiency. That's extra paperwork just to juggle the very complex multi-payer system that we have, and the ridiculously high prices we pay for drugs and for medical equipment. You take that inefficiency in the system, you reduce that inefficiency, you take that money, you use it to insure the uninsured and to better insure the underinsured. Then it comes out that you've covered everyone for all the care that they need, giving them choice of doctors, not choice of health plans, as the senator pointed out. And you've done it without increasing spending. And over time, because of the way single payer works to track and monitor spending and to negotiate payment rates, you will bend the cost curve. This has been the huge challenge in the US healthcare system over the years, is how do we bend the cost curve? Single payer, while assuring universal access and high quality care, also provides an opportunity to get these costs under control. There is going to be a little money that will shift from our current private insurance system, where people now are paying into premiums, and usually the employers are paying in as well. That will shift over to a public element to the financing, some new taxes. Those taxes will be designed, as they were discussed already for SB 562, to be fairer by putting a bigger burden on people who can better afford to contribute. So I haven't given you many numbers. I promised the senator that I wouldn't bog you down with the specific numbers, but if anyone's interested, I'm always happy to talk about it. That's my day job, and I will just leave you with those lessons. Let's just say again, more, better, fairer, cheaper. Thank you.
Thank you so much, Doctor. The doctor will be with us through about 11 o'clock. He has to attend a memorial service, and I'm really grateful, Doctor, that you were able to fit us in here today, particularly on this difficult day. So thank you so much, sir. We're now absolutely able to introduce Dr. Rick Flinders. Dr. Flinders has been a family doctor in Santa Rosa since 1980 and is chief of adult medicine at Sutter Health, as well as the director of inpatient education within the Santa Rosa Family Medicine Residency Program. He is here to be able to talk about patient health under a universal healthcare system and how it would work with your family doctor. Without further ado, a warm welcome to Dr. Flinders.
Thank you. I'm for single payer. And by this simple public declaration, I can probably no longer run for public office. Didn't intend to anyway. But without being targeted for defeat by the overpowering lobby of the private insurance industry. And I want to commend the political courage of the sponsors and those who have advanced this effort in our own legislature. Now, when I first said this, my friends advised me, get real, Rick. Politics is the art of the possible. Thought you were more mature, more politically sophisticated than this. In a nation buckling under the cost of a healthcare system that is no system at all, how did such a fiscal no-brainer become such a political non-starter? Historians have observed that in most wars, the first casualty is the truth. In modern parlance, this has come to be known as the fog of war. The battle over healthcare in our country has come to resemble a kind of social warfare, dividing us at every level of organized society, from our values and politics to 1/6 of our domestic economy. One bioethicist has called health reform our largest societal challenge since the abolition of slavery. Legitimate differences of belief and their expression in this debate are already confusing enough. But it doesn't help that most Americans have no way of understanding the Byzantine complexity of how our health services are provided and paid for. This fog of healthcare, as I call it, is no accident. It is a deliberate strategy of the profiteers who benefit most from our arcane system and who would lose the most if we were to adopt a more rational, more just, and more fiscally sound system of healthcare. Consider these few undisputed facts. And Senator Lara has gone through some of them. I'm going to add. Our system's broken, and it's breaking us. We spend more than anyone else in the world, and we achieve lousy results. The private insurance industry consists of 1,300 companies, 27,000 plans, 41,000 separate formularies, and costs each physician in the United States $84,000 annually just to administer billing and reimbursement. The pharmaceutical industry now charges $300 to $600 for a $6 medication that's life-saving in children with anaphylactic conditions. The average insured retiree in the United States will pay $250,000 out of pocket after the age of 65. And most of us, including the insured, live only one medical diagnosis away from bankruptcy. Remember these facts. In the weeks and months to come, when the fog of healthcare descends upon the upcoming debate, mostly from ads and voices paid for by the medical industrial complex, we will hear the familiar litany of lies and half-truths from the insurance and pharmaceutical industries. Don't get lost in the fog. Finally,
30 seconds.
Remember that get real is the same thing King George told a group of colonial complainers who said it was unjust to tax the unrepresented. It's the same thing William Lloyd Garrison was told when he advocated for the abolition of slavery. The same thing the suffragettes were told when they claimed that women were actually smart enough to vote. And the same thing a bus driver told Rosa Parks when she sat in the front row of a Birmingham bus. Single payer may not be perfect, but compared to what we currently endure and pay for, it's time we all get real.
Thank you so much, Doctor. The doctor is in. Watch out. Hey, there we go. We are grateful to be able to introduce our next speaker. Her name is Deborah Berger, and she's co-president of the National Nurses United and president of the California Nurses Association. How many nurses do we have in the house today? There we go. Watch out. This is a very safe gym. Thank you very much. My goodness. California nurses have led the nation in groundbreaking patient advocacy legislation, such as staffing ratios and whistleblower protections. And we are grateful that Ms. Berger is going to be presenting the reasons why single payer is so important, not just to healthcare professionals, particularly for patients here in California. Without further ado, Ms. Berger, the floor is yours.
Thank you. So my task was to talk about why RNs care about single payer and why California can lead the way in single payer. Both really simple tasks. The reasons nurses care about healthcare and why they want single payer is that every single day they go to work, they see patients that are sicker, that are dying, that are losing their limbs, that are getting kidney transplants, on dialysis, and worsening conditions, having heart attacks and strokes, and worse cancer progression when they see the doctor because they are priced out of paying for their copays, their deductibles, even if they have insurance. And we are sick and tired of going to work and seeing that our patients are suffering because of the lack of the political will in this country to actually do the right thing and get insurance out of health care. So what we want to make sure everybody knows is that SB 562 not only provides health care coverage, but it also includes dental, vision, nursing home care, and a pharmaceutical benefit so that people aren't going to bankruptcy to care for their family. Now, why can California lead the way for single payer? One is that California has been the leader in everything, in the environmental movement, in the social justice movement, in getting safe staffing ratios for our patients in the hospital. We are the way things are going, we're the only hope that this country has of having a rational way to have health care in this country. There are currently 5 states that have the Democratic trifecta, meaning that there's a governor and legislature that can move a single-payer agenda. In California, we elected a Democratic 2/3 majority in California. So all of our legislatures should be able to pass it. There should be a town hall in every single county speaking to single payer. We need to get that done. California has been a positive leader for change, and we know that that will happen. I want to add that every poll shows that single payer is popular in this state. 70% of those support SB 562, and 58% still support it after hearing all the, quote, bad news of the initiative. So it is a win-win. We will be able to do it. And from the nurses' perspective, if we don't put our beneficial bounty of resources into alleviating pain and suffering and guaranteed health care for all, then we have all failed. We will not fail our patients. California can lead the way if we affirm the policy of nurses' values of caring, compassion, and community. Thank you.
Thank you very much. We are just about 10 minutes away from opening up our public forum. If you are still interested in being able to fill out a comment card, we have individuals who are walking around currently. Just raise your hand and we'll give you a comment card. If you have a comment card that you need picked up, just put your hand in the air and we'll make sure and pick them up for you right now. We're about 10 minutes away from our public forum, and we'll also welcome individuals to be able to come forward and ask questions and comments as well. But before we do, we are grateful that Jody Reed is here. Miss Reed is the Executive Director of the California Alliance for Retired Americans. She has been all over this issue. It is a nonprofit organization that advocates for retired Americans and social political issues and seeks to achieve equitable living conditions for senior citizens. It's one of our state's largest senior advocacy organizations as well. Ms. Reed is going to be focused on universal health care and the benefit to California seniors. Let's give a Marin County welcome to Ms. Jody Reed.
Thank you. So as we saw earlier, I would say a fair majority of people in this room are on Medicare. And just to rephrase, Medicare is America's most popular social insurance program and does its work at less than 3% overhead while serving the hardest, sickest, frailest population. So if we can do that through a Medicare program, just think of what we can do by eliminating the insurance company overhead and providing a similar program for everyone, which was the original intention of Medicare when it was first passed into law in 1965. But over the years, since Medicare was first enacted, it has become a more privatized system. So there is a percentage of your Medicare that covers your hospitalization and some other services, but over the years, as our health delivery system has gotten more complicated with prescription drugs becoming more a part of how you manage chronic illness and other outpatient benefits, more and more of the healthcare needs of people who are eligible for Medicare need to be provided through supplemental insurance to pay for the things that traditional Medicare doesn't pay for, to pay for prescription drugs, et cetera. And so seniors are now both paying, while you were working, you were paying for Medicare. You still pay for Medicare through a Social Security deduction that goes into the Medicare program nationally, and then you still have to find supplemental insurance to pay for all of the other things that traditional Medicare doesn't cover. And so seniors are actually paying quite a bit for their health care. Under this bill, there would be no supplemental out-of-pocket costs. All of those would be wrapped around through SB 562. That's huge. Even more huge is that Medicare and its supplemental programs currently do not cover dental, vision, very limited durable medical equipment, long-term care, not just nursing home care, which I think if you ask most people in this room, they would say they'd rather be able to stay at home to recuperate from procedures or to live independently in their own communities with home care, which is completely unaffordable for most middle and other seniors. So the goal of this bill is to provide those comprehensive wraparound benefits that currently you do not get and have to pay yet another set of costs or insurance to cover through SB 562. That's huge for the Medicare population. You will have a choice of providers. So for most seniors and even people with disabilities, whether you're on Medicare or Medi-Cal, you are now forced into a managed care plan to provide those supplemental insurances and also to cover some of your hospital costs with Medicare reimbursing you. So you're stuck within the network of providers that your insurance company has contracted with, as well as the level of service that that insurance company suggests and the formularies for prescription drugs.
30 seconds.
So this bill will give you, it will be like having your Medicare card, except for the way Medicare was intended, which is you take it out, you go to whatever provider you want, they cover the services, you're done. Go home and get better. And that is what we've been fighting for all along, to expand Medicare to cover everything and everybody, and SB 562 does that. Thank you.
Thank you so much. We're grateful you're here, Jody. We are excited that Al Balak is here. He is the partner with Good Earth Natural Foods. It's one of the largest natural food grocery stores here in the North Bay with 500 employees and growing every day. And he has been focused, obviously, on healthy and nutritious food during his career, but he's also been focused on making sure that his employees have the best health care possible on the market today, which is why he has been focused on universal health care. We're grateful that Al is here representing Good Earth, as well as talking about the impact that a universal health care system will have on small businesses as well as employees. Let's welcome Al to our town hall.
Thank you. I have to agree that looking at the room and feeling the energy of the room here this morning, thank you all for coming out, that something did change in November, and it changed for me too, and the way we look as a business at this issue. Thank you, Senator McGuire, Assemblyman Levine, Mr. Lara, for your work and your leadership here. It's the issue of our times. The vision for healthcare for all that you all have, along with many of you in the room, is powerful and much appreciated. I am a part of a dynamic, pretty mature, small to mid-sized business here in Marin, Good Earth Natural Foods. We started in 1971. We have close to 500 hardworking staff currently. I became a partner 17 years ago when we had 30 folks with us. So we've grown over the years pretty sustainably. But as we have grown, the responsibility to provide more health care for our staff has also grown. And I've lived through this double-digit growth of expense every year for about 10 plus years now. And like many other businesses, we operate on razor-thin margins, and our ability to provide health care to our staff today is very challenging. There's confusion, there's obviously lots of complexity, lots of misunderstanding, and it's obviously quite expensive, our current system. There's real anxiety for so many that don't have clear access, and that anxiety really is daily, and I would imagine that's true for a lot of folks here today. It remains a focus for us at the stores, ownership and management, to take care of more and more staff, as we are in the business of providing health to staff and customers alike. We live by the notion that food is medicine, but that said, the need for access to Western medicine and all the tools of our healthcare system is really very critical for many, including many on my staff. The idea for Medicare for All resonates with me and millions of others. I've seen a groundswell of support, especially over the last few years, and especially lately as a result of our disastrous direction being taken by, I don't want to criticize, we're told not to criticize people, but there's some real loonies right now in Congress trying to change this direction. It's the issue of our times. We all need to come together, see the debate for Medicare for All with expanded glasses, understand the complexity, especially from a business standpoint. What's going on now isn't sustainable. It's time to really push forward with a single-payer system. There is one big, powerful industry that essentially stopped Hillary and has diluted the ACA. Let's take the profit out of healthcare once and for all.
30 seconds.
I support this California effort moving forward as a small to mid-sized business because the massive complexity of our current top-heavy system is not only not working, but it's out of control and has been for many years. We can do better. We can have a Medicare for All system right here in California. Thank you. Thank you all for being here today.
Thank you so much, Al. All right, ladies and gentlemen, thank you. Let's give a round of applause to all of our panelists and give them a big thank you. It is now time for the most important part of our town hall, to be able to hear from all of you. We're going to start with a written question, and then we're going to go straight to the microphone where we're going to invite Ellen Carroll to please come forward. Ellen is the vice chair of the State Board for Healthcare for All, and she has volunteered and does an amazing job. Let's give Ellen a round of applause and say thank you for her amazing advocacy. Ellen, we're going to have you just face this way if you don't mind. Oh, no, go ahead and stay at the mic and just face, if you don't mind, facing the panel. Yes, exactly.
Stay here and face you. Okay, how's this?
That's
okay,
great. Thank you.
That's good. Okay, my name is Ellen Carroll, and I'm very proud to be part of a pioneering single-payer advocacy group called Healthcare for All. This group has been working for 20 years to establish a single high standard of good health care for everybody living in California. I personally have been at this for only 10 years. I'm very grateful for the wisdom, the experience, and the mantra that we have now for our movement from the panelists, and we should be all very, very grateful for our panel, for our table of political leaders. This is the political leadership that we need and we deserve. And also, this is the leadership that is in sync with the majority of people who support single-payer health care today. It's the majority of people that the polls tell us about and the people that we saw in the July 4th parade. So many of you paraded from this school over to the town park, and we saw people waving and clapping and putting the thumbs up and saying, thank you for being there. We even had our esteemed anesthesiologist, where are you, John Severinghouse, who fell down in the back of the truck, got right up and kept waving to everybody. So we know that the majority of people support this, and this is the kind of leadership that we need. Right in this room is where the power is, the political leadership and the public majority. However, what I'm going to do today is asking all those people who cheered for us and all the people who are sitting here to join the parade, to do something to get involved. because I can tell you that with the emotional stew that we're all bathing in today, there is no better antidote than action. And there is plenty that everybody can do. You can invite people into your homes, and we can show one of the 3 great single-payer movies. You can invite a speaker to your service club or your faith group. You can table at Al's Market or any other market in your neighborhood and hand out information. Believe me, if everybody does something, we will get there. So ultimately, public awareness and support will be key to our victory. Without it, without everybody here doing something, we cannot prevail, but with it, we will. So please get in touch with healthcareforall.org. Go to your local chapter, Marin, and get in touch with us, and we will put you out there. We will spread the word, and we will get guaranteed health care for all. Thank you.
Thank you so much, Ellen. Thank you for all your hard work, and thank you for being here. All right, ladies and gentlemen, we're now going to go to our first question. Kara, I'm going to have you hit the button, if the green light, and if you want to give us the first question, please fire away.
Okay, this question is from Judith from San Rafael, and we have 2 that are similar. How can we minimize the profit motive in medical care? And then from Mary from Mill Valley, this whole plan is moot unless the for-profit insurance companies are eliminated from the equation. How likely is it that that can be done?
Why don't we start with Senator Lara?
I'll take the second question because I think it's kind of more direct in terms of, so what we've been looking worldwide is this kind of hybrid model that currently exists, but that every country has. You're right, it's going to be difficult to truly eliminate insurance, but there's a way that we can limit them to the point where they're no longer making the decision, and particularly to our preventative care and our, oh my God, I'm blanking out. Well, there is a way we can do this to really limit them in the scope of their ability to be able to determine the type of care we're going to receive. And so this proposal does just that. But if we're going to be realistic, we need to engage in a full battle. But we also see that there's other models that exist around other countries that have this hybrid model that still allows for the private insurance to do supplemental insurance for things that the public system's not covering, as long as they don't cover exactly what we're doing, because we do not want to disrupt our model. We see that this is the case in Germany, this is the case in Australia, this is the case in Canada, and in Great Britain as well. So we're open to having these discussions. This is why allowing for the discussion to continue in the Assembly is imperative for us to be able to continue to have this dialogue, which we will have with or without leadership in the Assembly, but we'll continue to move this conversation forward. This is our plan. This is our plan with the nurses, who, by the way, thank you, Deborah, for the courage that you have demonstrated in your organization. We stand on your shoulders and on the shoulders of the nurses for getting this done. So there is different models out there that allow for both to coexist, but we cannot allow the insurance companies to determine what our basic level of care should be, or them determining what the type of care that we get, which is the current problem that we have now.
Thank you so much, Senator. We're going to go to Deborah Berger quickly on the question as well. Just make sure you hit your mic and you see the green button. Oh,
there it is. Okay. So the question is for-profit medical care or what we have now, which was what we have now. The nurses included in the bill the just transition, so that people that want to continue being employed will have training to be employed. The other thing that you want to remember is that they're in the business of denying care, and we want to be able to get to approving care. What will help is a transition so that they will actually be part of a system that provides care rather than obstructing it. And what I think we need to remember is that nobody has cared about Penny's, Macy's, and Kmart laying off hundreds of thousands of people. People continue to still do shopping online. And I think we need to look at that industry and say, is there a place for denying care in this country? And our position as nurses is to say no. There is no position. SB 562 says put it in the hands of the clinicians, and that's exactly what we mean.
All right, thank you so much, Deborah. We're going to be going to our next question. Before we do, want to invite anyone that would like to be able to speak. We please invite you to please come up to the microphone. We'll come to you next. We're going to have individuals who do come to the microphone. You'll have a minute to be able to speak and give us your comments, but we invite anyone to be able to come forward at this time. We're going to go to our next written question, though. Carrie.
Okay. I have Kaiser, and I like it. What would happen to that system and those doctors under SB 562?
Why don't we go to Deborah, and then we're going to go to Jody. Deborah from the nurses.
Okay, Kaiser, I work at Kaiser. I'm not in the business of necessarily putting myself out of a job, but if everybody had health care and I didn't have a job, I'd be thrilled. But if you like Kaiser, you get to keep Kaiser. What will be killed in the Kaiser system is the Kaiser Medical Insurance Company portion of it. Kaiser will still do very, very well providing health care to our patients.
Thank you. Let's go to Jody from Retired Americans, and I'm going to see if Rick wants to be able to jump in on this as well.
Just to add to that, a key component of this is choice of providers. So if you're a Kaiser member and you like, as I do, going to like the one-stop shop of healthcare, then stay there. But if you want another doctor, you could move to a different system. Kaiser is two organizations. It's Kaiser Permanente, which is the insurance side. They sell the memberships. And then there's the medical group, which are the providers, the clinicians, the people who take your blood. They will still exist. And if you like that system, you can use that system.
Thank you so much. Dr. Flinders, quickly, do you want to jump in on this one?
Yeah, I think they've answered
If you can pull that close to Dr. Colfax, can you give Dr. Flinders your mic?
I think my panel members have answered that question. Just think of Medicare. In Medicare right now, you can go to Kaiser, you can go to Memorial, you can go to Sutter, you can choose your own private physician. And I don't think there's any reason to believe that in the future, if we did achieve a federal or national-wide single-payer system, that you would have those same choices.
Thank you so much. We're now going to go, sir, if you don't mind stating your first name and your city, and we welcome you. You have 1 minute.
Thank you. Hi, I'm Tim. I'm from Corte Madera. And I think I'll put this out to whoever. This state has innovated in ways in businesses that has been unbelievable. What have we done to loop in those innovators? What have we done to loop in those people that are thinking about ways in technology and otherwise? I don't want technology making my healthcare decisions, but I absolutely want technology assisting in the background to lower the cost of administration, to make better healthcare decisions, because it seems to be that we're able to go that way. Can you address that for me? Thank you.
Tim, thank you so much. I have a quick comment on that one, but I want to see if anyone... So there's Tim, I want to get your email address. There's a great commentary in today's Wall Street Journal, exactly what you had just mentioned, talking about how technology is going to be able to help drive down the price of healthcare here in the years to come. And in fact, it's probably going to be one of the biggest drivers to be able to drive down the price of healthcare. Would love to be able to send that to you. It's an individual who says we desperately need innovation, but one of the biggest challenges in innovation are those profit centers that currently exist within our healthcare system, which is why we are all here today to be able to talk about that. Tim, before you leave, I'd like to be able to talk with you about that, but I'm going to see if Senator Lara, anything or Ms. Berger in regards to innovators that you're linking with in regards to the bill on this issue. Any of you, please, Senator Lara.
Technology is going to play a key role, especially when it comes to mainstreaming and streamlining the healthcare delivery services that we're looking to be able to achieve. Cutting the redundancy, cutting all that, we're going to need the technology to do that. We are currently engaging with several folks at the statewide level to bring their ideas. This is why, this is a massive undertaking, not one that we should be afraid of, but one that we should be doing carefully and engaging all the bright minds that we have in the state to make sure that, again, we cut down the red tape, we cut down redundancy, and we deliver a better product for all Californians. We are keeping all that in mind. We take that to heart, and we appreciate your question.
Thank you, Tim. Before you leave, I do want to get your contact information. Let's go. Oh, please. I'm sorry. Assembly member, I apologize.
No worries. It's a great question. We're already seeing the impacts of some of the technological innovation in healthcare delivery, particularly with the patient-centered approach to medicine, where doctors have a better understanding of all of the treatment or all of the medicine and prescriptions that patients have. The other thing that the legislature has done with this is gotten the pharmacies to be on a system where they have an understanding of the prescriptions that people are on to, one, see if there's abuse of multiple prescription providers to obtain more of a medicine that they should not be getting, and also, of course, to see what the impacts of those mixed prescriptions could be. So we have been using it as we've been able to get it to protect patients and as well as to protect public safety. There's obviously a lot more that we can be done as we're looking to save costs on a broader scale on patient outcomes.
Thank you so much, Assemblyman. We're going to go to our next question. If you don't mind just stating your first name, we welcome you.
Yes, hi. My name is Olga Osborne, and I've been a registered nurse for 48 years. I've been retired for about the last 5 years. And I want to thank, first of all, Senator Laura and Atkins for writing this bill, and also for the nurses who asked them to write it. And I want to thank Bernie Sanders, who has been a big advocate for single payer all this time. And I want to thank, he deserves a lot of applause. He's been the most advocate, and for some reason, we don't really hear him getting the praise that he should get, except by the progressives. And I want to thank Roseanne DeMauro and Deborah Berger here for leading the nurses, and the nurses themselves for fighting for single payer. My question today is actually, what are you going to do to fight Big Pharma, the insurance companies, when they're going to throw millions of dollars to sabotage this whole thing? And we hear all the time about people getting paid off, on not fighting for this bill, not fighting for single payer. And I don't think this is conspiracy theory. I think this is happening. So I want to know how you're going to fight these insurance companies with the big bucks.
Thank you so much, Olga. We're really grateful you're here. Why don't I start with Senator Lara, and then I'll look to our panel to the left as well.
Thank you. Well, we're fighting them now by simply being here, first and foremost. Second of all, this is not going to be a fight that is just going to be led by the legislature. It's going to be all of us in this room fighting together. We all have the same responsibility, and know that we need to hold not only each other accountable, but we need to hold everyone accountable, because this is the right thing to do. We are on the right side of history here. When this is all said and done, when we finally get universal health care, we are going to tell the haters, pharma, the insurance companies, that we were right all along. We just have to stay the course, stay with us, and ensure that we work together. By having, your assembly member here, by having your senator as well, we have a broad coalition of folks that are hell-bent on getting this done. Let's just work together to make it happen and stay the course. Let's not divide ourselves. Let's move forward.
Yeah, I first of all, just thank you for the question. Thank you to Senator Lara for his response. We are doing the work, and it's hard work, but we are having this really large conversation with the public, bringing everyone into the solution. Once we do this work, we then need to tell the truth about the solution and build the political will by demonstrating the work that we've done, by enlarging this conversation to include everyone in it. And I have a lot of faith and a lot of confidence in the political system that when we show people that we've done this work and we tell people about the work that we've done, that we will have success on healthcare.
Thank you so much. Dr. Flinders.
Yeah, just very quickly, I don't think you have to invoke conspiracy theory at all. This is called corporate planning. This is the business plan of the large corporations. And the antidote, I don't think is even political. I think it's educational. I think the antidote is the inoculation of the public about what is really happening. I do believe that most Americans, blue, red, Democrat, Republican, whatever, have one thing in common. They don't like to be screwed in a business deal. And I think if most Americans knew how much they were paying for how little they're getting in return compared to other nations and their health systems in the world, they would be more than irritated, but they'd be well educated too.
Thank you, Doctor. And I think it's going to be up to all of us to be able to flip this conversation. Again, the United States of America spends more money on healthcare than any other industrialized country. We spend $3 trillion a year. And what we get from it is some of the worst rankings when it comes to health. Again, the World Health Organization ranks us 37th in overall positive health outcomes, 39th in infant mortality, 36th in life expectancy. And that is with America's economy being the largest in the world. California has the 6th largest economy in the world. We need to be talking about the issues in regards to how people are literally dying because of our poor healthcare system. And we need to point out the inequities within our system right now of those who have and those who don't. Am I right? And so I think it's going to be up to all of us to be able to advance that starting here today as well. Let's go to our next comment. And if you can just please state your first name. Sir, we're going to come to you right after, and then we're going to go back to our written comments. Ma'am, welcome.
My name is Burr. I'm from Sausalito. I'm a small business owner, and I don't really have a question. I have a comment for the record,
Please.
And that is, in addition to all the benefits of single-payer health care for Californians' health, it also has a net benefit for the California economy from the point of view of business. With single-payer health care, young people with great ideas will be able to leave their jobs and start creative, innovative jobs. People will be able to change jobs, get better jobs. There will be fewer bankruptcies, which is very expensive for a state. So not only would single-payer health care make Californians healthier, but it would also make California economy healthier.
And also to dovetail on that, is that for our business owners, worker comp goes away.
Oh.
It gets absorbed into the system. So business owners should be clamoring for a universal healthcare cost. I mean, the cost for workers comp skyrockets.
It's incredible. As a business owner, we pay unbelievably high cost for workers comp. So that's extremely good news. Thank you.
Thank you so much, and thank you for being here. Sir, we welcome you, sir, to the microphone. Welcome. Yes, sir.
Oh, thanks an awful lot. My name is Patrick Fahey, retired math educator, and I still teach actuarial mathematics. And I have a copy, and I want everybody here to be able to get a copy of the Perry report from Amherst. This is the one that Ricardo Lara was citing. He has done his homework. He knows his numbers. I did ask a number of other Democrats. I'm trying to get, I hope that everybody, I will provide the link to everybody so that you read this 85-page report so that we not only answer the questions that people have, but also ask the questions people need to ask and answer those, okay? That's another level. So thank you, Ricardo Lara, for doing your homework.
You have about 30
People
seconds.
need to, now, the question is, I wanted to know was, by the way, the study does not address economic impact, things like private investment, employment, household consumption, transition costs, things like that. But that's the next answers that we have. Now, the question I wanted to ask you, Ricardo Lara, Senator Lara, how did you let Governor Brown get away with the canard that SB 562 had to be pulled because they didn't say how to pay for it, when both the Lewin report from 2005 and this report, the Perry report, both spell it out in marvelous detail. Could you please explain to me how the Democrats didn't counter that argument? Because that's out there.
Thank you, Patrick, very much. Mr. Lara.
Thank you for that
I didn't
question.
mean to run away. Go ahead.
I think if you know Governor Brown, you know that you don't tell him anything. I was just as surprised as we were all surprised when the bill was pulled. The fact that we wanted to give an opportunity for us to actually be able to highlight the report, the financial study that we had worked on. The fact is that the study takes a while. We wanted to get peer reviewed. We wanted to be able to have experts look at it. And we were prepared to have that dialogue in the assembly. So when we heard it got pulled, we were just as surprised. So what we're going to do now is we're going to be meeting with the speaker and having a conversation about what is a plan for us to be able to allow for us to be able to share the report with the members of the assembly to demonstrate that there is a financial plan, that it is a plan that's peer reviewed, and that we have real cost estimates that declare and show that we actually are saving money. So we're going to have those dialogues. I haven't had a conversation with the governor because I wanted to have the financial study done first before we go to speak to the governor to be able to have that dialogue. You know, you don't, when you work with this governor, you got to have all your T's crossed and your I's dotted. We will have that now, so I hope they give us an opportunity to be able to plead our case. And you know, I'm resolute. I'm not going anywhere. We're gonna have that conversation with them, whether they like it or not.
If anybody,
Thank you so much. Real quick,
anybody would like a copy, I'll provide a copy.
Okay.
Thank you very much.
So
A link.
the link is on healthycaliforniaact.org. healthycalifornia.org. The link is there. Robert Pollan is the author of it. And then I want to add that the funding mechanism was clearly understood to be part of the bill, and we were actually working with the Assembly, the leaders in the Assembly, to incorporate that bill and many, many amendments based on the groups that we work with. What we need you to do is call Speaker Rendon. His phone number is 916-319-2063. 916-319-2063.
All right.
Call him and ask him to release the bill.
Thank you so much. Let's go. Thank you very much. We're going to go over to Carrie with let's do 2 additional questions, written questions.
Sure. We have one from Kristen, who is a mental health care practitioner at Marin General. She says, we routinely have to cut patients off before they are stable due to insurance assessments that they no longer need care. It's scary. How can we make sure that we get mental health care for all Californians?
Thank you very much. I'm going to go to Dr. Colfax because I know that's been a real big issue for him, and then we'll turn it over to Senator Lara. Dr. Colfax.
Yeah, thank you for that question. We know that mental health, behavioral health issues are key both for the state and locally. We're still strengthening our system. I would start by saying that Obamacare was a big step forward with that, right? In parallel with implementation of Obamacare, there was mental health and substance use parity brought forward so that companies, for now, need to provide equal level of services for behavioral health as they do for physical health. That's a big shift. I think, though, with single payer, we start to see a shift where we can even expand on that even further, right? So I think that the questioner is very familiar with the fact that with regard to behavioral health, we're constantly negotiating with insurance payers about how much it costs, about access to the beds that people need, expensive medications, coordination of services. We have a fragmented system, people move in out of Medicaid, Medicare, private insurance. We don't have systems in place because we don't have a unified system to actually care for people more effectively. So I think what universal care will do, Medicare for All will do, it will cut the red tape. It will focus on the care of the person rather than on administrative details. And it will actually strengthen our system because it will increase the coordination and information that we're sharing. And finally, it will take the burden off the families that I talk to every day about what it's like to have a family member sick, struggling with the system, unable to negotiate, dealing with administrative and bureaucratic delays. I think that it was said earlier, universal healthcare puts the focus back on the provider-patient relationship, and that's where we need to be with behavioral health.
Thank you so much, Dr. Colfax. We're going to go over to Senator Levine and then Senator Lara.
Well, I'm very sensitive to the mental health issues. It's an area that I've worked on quite a bit over the past 5 years in the legislature, and we're not waiting for SB 562 on this. And in fact, Dr. Colfax approached me earlier this year on crisis stabilization units. And not only is insurance coverage a barrier, but often state law is a barrier in making sure that people can get the care that they need. And so I've authored legislation that's in the Senate right now, and it will allow for what was a 24-hour cap that someone could be in a crisis stabilization unit to allow them to be there for 72 hours to make sure that they are stabilized before they are released. And so this is something that we are paying attention to and trying to address mental health as much as we can, and there's no reason to wait around to do it.
Thank you so much. Let's go to Senator Lara.
Just to note, of course, we know how important behavioral health, mental health issues are. Under our plan, that would be fully covered for everyone.
Thank you. Let's go to our next question.
Tom from Marin would like to know what the effect of SB 562 will be on Medicare recipients.
Thank you so much. Why don't we go to Ms. Reed first. Ms. Reed.
Is this on? Is that on?
You're good.
The question was, what impact will this have on Medicare recipients? So a couple things. Initially, those of you how many people pay for Medicare directly out of your Social Security? It comes out of your check. So initially, you'll still be doing that. And what we're hoping is to move all those dollars into the single payer pot in California. And all of your services, whether it's hospitalization, which is what traditional Medicare covers, as well as any outpatient or drug benefits, will be covered all through our system with the dollars here in California. That's going to take a while to move those federal dollars here. So Medicare, as most of you know, is when you have supplemental insurance, Medicare is always the primary insurer. So first you look at what Medicare covers, and then figure out what it doesn't, and that's where your supplemental comes in. All the supplemental coverage will be provided through the Healthy California plan. You won't need to buy a separate coverage. For those of you who have retiree benefits that your employer or your union negotiated for you, they don't have to pay those anymore. They will all be part of the system so that you won't have co-payments, no deductibles, no wraparound coverage will be needed. And you will get all of your care either covered through the traditional Medicare system or through the Healthy California plan until we're able to merge both of those systems, which is, that transition may take a while. It will be completely seamless for those of you who are Medicare beneficiaries. You'll just pick your doctor and you'll have your Medicare card and your Healthy California card, and that will cover everything. It's more as an administrative question how that gets handled, but for you, you won't have any out-of-pocket costs, no supplemental coverage, and you'll get more expansive benefits that you're currently not getting through this system.
Thank you so much. We're going to go back to our speakers, and just because we have a large group of folks and we're grateful and thank you for your patience, going to ask if it's okay with folks to keep your comments to 30 seconds, just since we have a lot of folks that are wanting to talk. Sir, we welcome you and thank you so much for being here.
Robert from Greenbrae. This is a wonderful group that's here this morning, but unfortunately, something's missing. Right now, our millennials are enjoying a leisurely and undoubtedly well-deserved Saturday, but they need to understand that they too are going to be the direct beneficiaries of the efforts that the people in this room are making, and it is incumbent upon us to give them a very gentle and yet very direct reminder that they need to get involved. Thank you.
Robert, well said. Thank you so much. Thank you very much for being here. Sir, we welcome you. If you can just give us your first name, and thank you so much for your patience. I apologize about the wait.
I'm Greg Johnson. I'm a disabled vet, served in the Special Forces, had a traumatic brain injury that results in multiple seizures. In the last 2 years, over 30 times I've been in the hospital. I've found my disability benefits have gone down $300, and the additional costs that I have to pay now on top of Medicare and Medi-Cal, I've nearly become homeless again. I was homeless as a result of the health care costs that I've had to pay. Thankfully, Western Boat Shop in San Rafael donated a non-running but an older wood yacht, so I've had a place to live. But this is just getting out of hand. Thank God to UCSF, you guys are the ones that did the neurosurgery for me, and through the school, I got it for free. Thank you. But we really need to fix this system, and I support that single payer thing because I'm becoming broke.
Thank you so much. Greg, we're grateful you're here, and let's give him a round of applause and thank him for his service as well. Thank you, Greg. Thank you so much for being here. Supervisor Arnold, please go ahead and chime in. Greg, I think the supervisor wants to be able to say a few comments. Please.
Gregory, I'm here. Have you visited the Director of Veteran Affairs for Marin County? Okay.
Yes, John Stevens. I have an appointment to see him on the 8th. That's the
Okay.
earliest I was able to
Great.
get.
And-
On the 26th of June, I had a seizure in the parking lot up at the harbor. Ended up in Marin General, and that was June 26th. While in the ER, suffered another seizure in the ER. Once I was stable enough, they moved me up to ICU for 4 days, and then another 2.5 days in the general ward. They discharged me early. I don't know why.
Okay, if you come to the table, I'm going to give you my card. You call my office, okay?
Because I could
We'll see
barely
what we can
walk
help.
when I got discharged.
Okay.
And then now, when I look at you guys, instead of seeing one, I see two, and that was from this most recent seizure.
Thank you, Greg, very much. Thank you, Supervisor. Ma'am, we welcome you. You have 30 seconds. Please come on forward, and thank you for your patience and for hanging with us.
Hi, my name is Nancy. I'm from Terra Linda. I'm proud to say I'm a nurse as well, and I'm so grateful, Deborah, that you're saying we are all sick and tired of seeing our patients in the position that they end up in because of lack of preventive care. Also, I'm really happy that there's economic studies to determine the actual cost savings of prevention, which is a mathematical question mark for most of us, because how can you measure what doesn't happen? So I'm here to talk about something unusual, which is the cost of education that healthcare providers have to take out student loans for. And that is limiting the availability of actual care coverage for patients because there are not enough providers to cover the total population. In Massachusetts, when Mitt Romney was governor, one of the problems that happened was a lot of people had insurance coverage, but they were waiting months and months because all the doctor's offices were backed up because there weren't enough of them. I think it's in France that medical school costs are actually covered by the government. So if you're going to go to be a doctor, you don't have to pay tuition. My daughter is a doctor of pharmacy. She met her husband in pharmacy school. So now we have a household with 2 six-figure student debts.
Nancy, I don't mean to be pushy at all. If you don't mind just getting to the question or
So my question is it possible to include somewhere in the legislation or in the enactment of the legislation a way to actually eliminate tuition for all the grad students so that accessibility will be more than just a theory, but there will be actual people to provide the service, not just doctors, but speech therapy, optometrists, all of that.
Thank you.
Thank you very much.
Not at all trying to be pushy, please.
You brought another critical component to this entire conversation, the fact that we don't have enough doctors, we don't have enough clinicians and nurses that will have to meet the demand once we get a universal healthcare option. What we've done this year is actually in our state budget is increase our medical residency slots. That gets funded through the federal government, and those allotments are given by the feds. So we're working to be able to increase those slots for California, because even as it is now, we don't even have enough doctors for the current population. So this is why we have to take a step back to figure out how do we not only train the doctors that we need, or how do we incentivize the doctors that we need to come in to California and the nurses and the clinicians to stay here, and hopefully they can afford a place to live, which is another question. But that is something that we've been tackling in general, in particular in the assembly, talking about student debt and what that looks like for every student. The fact is that you're right. The conversation we had with the doctors in Canada said the big difference for us is that the cost for my medical education is the same as if somebody getting a history degree. And so it allows for them to be able to make the decision to practice in underserved communities, to practice in community clinics, because they don't have that tremendous debt to be able to have to force them to go into a big HMO to be able to pay off that student debt. So it's definitely something that's a part of this discussion and that cannot be dismissed, because if we don't have the doctors to care for the people, then this whole point is mute. So thank you for that. You brought a very
So you're
good
building
point.
something in. I would actually request that would
just
be
real quick,
eliminated.
I apologize. Just 15 seconds, just because we have a long queue behind you.
So the bill does not include anything on, it would be a separate code section that deals
Okay.
with education and loans and student debt and loans, and then also what the mandate will be on the state to cover that. So that would be an additional hit for the state as well. So it is definitely part of the conversations. It's not part of this bill because it's a different code section that we're
Okay.
talking about. But I appreciate you bringing that discussion in this point, because we forgot to bring it up as a panel as well. So thank you.
Great, thank you so much.
Thank you so much. And again, just going to ask folks if you can just keep your questions, comments about 30 seconds, since we have a lot of folks who are going to want to speak. I know all of us are going to be hanging afterwards, as the Assemblyman just said, and to be able to answer any questions. We're going to go to a couple of written questions quickly. Let's go to Carrie.
Sure. David from Corte Madera. If we succeed in California, but the GOP cuts Medicare and Medicaid dramatically, are we toast? Will California suffer unduly?
Well, this is why we're moving to the system, because no matter what the federal government does now, whatever version of the ACA that they're going to implement, we know that roughly we're going to get close to $5 billion less if they move into these block grants. So that's money that we're going to have to overcome to cover the people that we're covering now. So this is why this is the perfect storm, you could say, for lack of a better word, for us to have a real conversation about a universal healthcare option, because the feds are going to dismantle healthcare. We're going to have to bear the brunt for receiving less money. So the only option that we're left with is the right option, which is to provide a universal healthcare option for everyone, given the fact that DC is hell-bent on destroying healthcare. So this is the only viable option that we're going to have moving forward.
Thank you so much. And we're going to go to Dr. Flinders quickly.
Very quickly. It's not only the number of physicians that we have, it's the kind. And we all know that the primary care workforce is essential to any healthcare system. Throughout the world, about 50% of the physicians are primary care. That's family practice, that's geriatrics, that's the primary providers of healthcare. And our system is right now about 70% specialists and 30% family docs and primary care providers. So we need to provide not just relief from the cost of medical education, but provide incentives for people to choose specialties in which they may not get fabulously rich, but they will be doing the kind of service our workforce needs.
Thank you. We're going to go very quickly to our next speaker, 30 seconds.
Thanks. Thank you for all the work you're doing for Californians. My name is Julia Black. I'm a graduate student from San Jose, California, and we recently had an event on the 4th of July raising awareness about SB 562 and single payer. I have a British parent, so I'm very well aware of how well single payer works in Britain and other European countries, but what can we do to better educate the general public about single payer? Because all the time we hear we don't know what it's going to cost, how we're going to pay for it, and I know those are Republican talking points, so how can we best address that? Thank you.
Perfect. That's good news. That's a good point. I'll tell you, education is going to be key. We have to educate the public on how much they're spending now, how much we spent as a state currently. So to combat that $400 billion price tag, we're spending $368 billion annually already. And for the folks who don't have any insurance, which by the way, the majority are millennials that somebody came and talked about, who don't have insurance, they end up in our emergency rooms. And that costs us triple the amount of money. Cost us annually as a state close to $3 billion annually. So we need to do a much better job of having people understand, first of all, how much we're paying now and how much they're individually paying. Close to $10,000 as a family now. And the other thing we need to focus on is helping them understand that, look, government works. Government has accomplished some amazing things in this country. We have to get out of this rhetoric of this American exceptionalism that we still have, that you have to pick yourself up by your own bootstraps. I can do this on my own, which other countries don't have. Ask any Canadian, what makes you Canadian? The fact that I have universal health care, that a neighbor has universal health care as anybody else. So we have to kind of combat that centuries of just being able to unabashedly attack government like Republicans do all the time. The other argument you're going to hear is, oh, now government's going to be in charge of your health care. Well, government will do a much better job negotiating against pharmaceutical companies, because currently you're the one that's negotiating against pharmaceutical companies. And we're clearly losing. So I'd rather give the power to our government to negotiate on behalf of us against the pharmaceutical companies, as opposed to me as an individual, which is currently happening now. So we have to, really, it's going to take a while, but we need to educate the community outside of this gym and continue to do so. Those events that you do, the events that we're doing across the state, events like this allow us to do that, and we're committing to continuing these events, because as soon as people understand the data, the supervisor said it clear, the data is on our side. The data does not lie. We will win under a universal healthcare system. We will pay less, but people don't really understand how much they're paying now, and this is what we have to make sure they understand. Thank you for that.
Thank you very much, Senator. We're going to go to Dr. Colfax quickly.
I would just make 3 points over and over again. Medicare for all, cuts out big insurance, better value for the dollar.
There we go. I like it. Thank you so much, Doctor. Carrie, next question.
This question is for Ms. Reed. From Bob. How do we get AARP to support SB 562?
Uh-oh, now it's on. All right, hey, there we go. So you want to repeat the question?
The question was, how do we get AARP to support single-payer or universal health care? I don't think we do, as an organization to organization. They're a health insurance provider. They're the biggest provider of Medicare supplemental insurance in the country. And they make their money that way. So even though they're, on the one hand, a very strong advocate on behalf of seniors and retired people on some issues, on health care, I would really question their motivation. However, that doesn't mean that we should not be talking to seniors. And the thing that we really need to remember is seniors are probably the most regular voting bloc in our country and in our state. They're not people we have to talk into going to the polls. And they, as history has shown, are targeted by the insurance industry with the argument that you're going to lose your Medicare if we vote for this bill. And so part of this goes back to the last question. We're not going to necessarily take on AARP, but we need to talk to each other. We need to talk to our parents, our grandparents, our kids, our grandkids, and have individual conversations. I think the doctor said earlier we need to inoculate ourselves from the attacks that are going to be coming from the insurance industry and the pharmaceutical industry. This is not the end of Medicare. This is actually the expansion and improvement of Medicare for everyone. And we need to keep telling people that. So
Reed,
I don't know the answer about AARP, but I know we have the ability to talk to each other, and we need to do it.
Thank you so much, Ms. Reed. I'm grateful. So just for panelists as well as those who are going to be speaking, know that we're approaching noon. If it works for folks, we'd like to be able to continue past noon. Is that okay with everybody? Thumbs up, because we have a lot of folks who are wanting to be able to speak. Yeah, absolutely. And then we also have several other cards that we want to get to. Going to ask each of our panelists to be able to keep your answers to 30 seconds or less. Going to ask each of our speakers to be able to have your comments or questions to 30 seconds or less. Carrie, let's go to the next question, then we'll go back to in person.
Sure. Fern from Corte Madera. Everyone wants health care, but how are you going to ensure everyone pays their fair share?
Ms. Berger, you want to jump in on this one?
Sure. The simple answer is that the system for paying will be very, very transparent. If you have a job, part of your payroll tax from your employer will go into it. If you're part of Medicare, you're already paying into the system. There are sales tax, and then there's also credits for people that are at the federal poverty line or below. So everybody pays their fair share. We make sure that people that can afford it pay more into the system because they benefit from having a healthy society.
Thank you so much, Ms. Berger. Let's go quickly to Mr. Lara.
Thank you. So under our funding scheme, just so you know, under our scenario, what we're proposing is a gross receipts tax on business earning more than $2 million that exempts most all small businesses, and a sales tax that exempts spending on housing, utilities, food, and home and services, which we think really captures I think the majority of us, but also is very sensitive of those low-income Californians that may not be able to afford it. So we kind of spread the love amongst everybody equally and in a manner that's fair. So, and we're not penalizing our small businesses, so which we know are the backbone of our economy, are the ones that continue to grow. So those are just, again, this is one financing plan. The plan for us is to put something out there, engage the governor, engage the assembly, and come up with something that would work for everyone. So, but we wanted to just let you know we do have our plan in place that the nurses and the Senate worked on. So these are some of the ideas that we have. Again, that's the financing piece of it, but we're open to other discussions. This is not just a one single conversation. We want to be able to engage other folks as well.
Thank you very much, Mr. Lara. Let's go to our next speaker. Welcome, sir. 30 seconds.
Thank you. Peter Lax, Fairfax, California. Real quickly, there's a rally on Tuesday. If people want to take buses up to Sacramento, talk to some of the nurses over here from CNA. Real quickly, a word of encouragement. $27 billion in profit from the private health insurance in California. Assembly Speaker Rendon receives $700,000 in contributions from health insurance and healthcare industries, according to Open Secret. This is big bucks. These are not campaign contributions, these are investments. And they are getting an amazing return on their investment. Thank you so much, Senators, for bringing us where we are. And Mark, I'd really like to encourage you to take a leadership role on this. Please.
All right, thank you very much.
Join the other 8 assemblies members who are sponsoring SB 562. We know that the Democratic national leadership is opposed to single payer. They get a lot of money from campaign contributions, and this is where it gets hard. This is where all of you really need to stand up, not just to the Trump administration, but to the corporate leadership of the corporate Democratic Party.
Thank you very much.
Thank you so much.
Thank you so much. Thank you. And again, not at all trying to be pushy, and I do apologize if I'm interrupting. We just have a lot of folks who are behind you, and just want to make sure that we have everyone have a chance to speak. Doctor, welcome.
Thank you. I'm Brian Stomp from Novato. I'd like to make a little analogy here. This is a little bit like establishing a beachhead in World War II, and we're all here having this discussion because those beachheads were discovered. And the first guys out of those landing barges took the highest casualties. First guys out of the landing barge for single payer is Mr. Lara here and co-sponsor Mike McGuire. Thank you. Judy Arnold got a unanimous sponsorship from the Marin Board of Supervisors. The San Francisco supervisors did the same thing. The $37 billion figure that Mike McGuire mentioned that we're going to save annually came from a report that the nurses paid for by 4 PhDs at the University of Massachusetts. Very important report.
Mr. Stump,
and there's been a lot of figures bandied around. Mark Levine was sent a copy of this report because he hadn't read it, and I asked him today whether he'd read it, and Mark hasn't read it yet. So the landing barge, these guys are out. Mark is still in the landing barge. We need to know, Mark, whether you're 100% behind single payer or whether you're going to hang around saying, I'm generally for it, which you've said.
Okay, thank you very much, Mr. Stump.
Brian, thanks for your question. I've had about 5 different people talk to me about 5 different reports that are completely different that I need to read today. So I appreciate that everyone has a different report that I also need to read. So there's a lot to do. This is pretty much an issue that we're all dedicated to dealing with, and that's why we're here today. And we've had about 2,500 bills before us this legislative session. I've been working with Senator Lara for a number of years. I like and respect him. He's very busy. I try to work hard as well. We actually haven't had a chance to talk about his legislation until sitting together today. And so there is a lot of work to be done, particularly on SB 562, but I'm leading the conversation on getting universal health care for everybody. Single payer can be the way for us to go. And so this is part of educating everyone and hearing from everybody. And I'm glad that you are a fierce advocate for this. I've known you for a number of years. There's not one time I've ever seen you where you have not told me exactly how you feel about this issue. And this goes back to 2012. So I thank you for your leadership on this. Thanks, Brian.
Okay, report's been out since May.
All right.
That's a lot of time. And it wants 100%.
Mr. Stump, we're going to have to move on.
Mark.
Thank you so much. I'm very grateful. Thank you for your advocacy. Thank you so much, Assemblymember. Ma'am, we're going to come to you. And again, I'm not at all trying to be pushy. I'm going to ask you, just because we have a lot of folks in line behind you, 30 seconds, please.
Absolutely.
Welcome.
Hello, everyone. My name is Susan George. I live in Vallejo, California. I'm an Assembly District Delegate for District 14. I'm very happy to be here.
Thank you.
Assemblymember Levine, 82% of Democrats nationwide want a universal health care system. 70% of Democrats, 70% of people in California are in favor of what SB 562 provides. What will you do to convince Assembly Speaker Rendon, who is what is standing in the way for this to move forward so that we can have this go through the process, because Democrats are obstructing what Democrats want?
Susan, thank you so much.
I think that's a great question. I can't speak for the speaker on what he did, and I'm not here to defend what he did. This is probably the single most important issue we're dealing with right now. Right now. And when we are threatening to take healthcare away from people, this is a threat to our lives. And everyone in Sacramento understands that. And we in the Assembly are talking about this on a daily occurrence. And we meet as Democrats weekly. And each of our caucus meetings, we are talking about this issue. And also, some of the challenges that are coming across to us. Now, I think most people will recognize that, a 7.5-month legislative session isn't really enough time to get through all of the issues and questions that Senator Lara, I think, really detailed well in his opening remarks. We have a process that unfortunately has been stalled, but that does language and get those things worked out so that we can move forward with something that's actually going to solve a lot of the challenges that have been raised today. And we're dedicated to doing it. I'm really grateful for Senator Lara to come to my assembly district to help educate the public and talk about this issue. And let's hear it for Senator McGuire for emceeing this. He's done a really amazing job. And so we're dedicated to raising the level of public discourse on single payer and universal health care. And you coming out here today and asking the questions that you've asked and telling us how you feel, it equips us to go back to Sacramento and spread that message.
Thank you very much. We're going to go to our next, real quick, everybody, and I appreciate everyone's patience. We're going to go to our next question.
Lynette would like to say, my daughter has Medi-Cal through waiver because she needs 24-hour care. Will this be affected? And how do we protect people with pre-existing conditions?
Go to Ms. Reed.
Is this on? Is it on?
Yeah, you're good.
So for everybody who is getting in-home care already through Medi-Cal, in this our current system, they will continue to get that care. There will be no loss of benefits to anyone. The goal is to ultimately move all of the rest of us to get those benefits, because for most of you, home care is completely unaffordable. Completely unaffordable, whether you only need it for 8 hours a day or 24 hours a day. So if you're low income enough, you're eligible for in-home supportive services, which is a Medi-Cal waiver program. Those folks will continue to get it. They will not lose any benefit. And the rest of us will come into those benefits over the bill says 5 years. So that's a huge improvement to the situation that we're currently in. Was that the whole question?
That's great.
Okay.
Thank you. Why don't we go to one additional question, and then I'm going to see if there's any specific questions for those who are, thank you all for your patience, who are standing. Senator Lara is going to have to catch a flight here. He's going to have to leave in the next few minutes. I just want to see if there are any specific questions for Senator Lara. If there are, if it works, okay, great. We're just going to go next to those specific questions. Please carry this to another written, please.
From Michael, how will California residency be defined to determine eligibility?
How will California residency be defined? Let's go to Ms. Berger quickly.
Very simple. You live and can prove you've been living in California for 1 year.
It's the exact same requirement that we have for any of the other medical services to be able to qualify, if you need to qualify through a residency in California.
That's great. Thank you. If it works for folks, if we have specific questions for Mr. Lara, I'm going to, and if you don't mind, just quickly, please come on up, and thank you so much for your service for many, many years, 30 years here in Marin.
48.
Oh, crap. I just totally screwed it up.
That's okay. No,
hey,
thank
you
close.
so much.
You're close.
Thank you.
Frank Ager from Fairfax, and I've been in a fight for single payer in California for over 25 years. I'm wearing my Prop 186 button from 1994. We lost that one, but we're coming back. We're coming back strong with the nurses and the leadership, of course. So here's the issue: we in public agencies have hundreds of $millions in unfunded retirees' health care costs. We've put hundreds of $millions in the funds already, but we are so far in a hole. How is single payer SB 562 gonna benefit our cities, counties, and special districts with their unfunded employee health care liabilities?
Thank you very much, Mr. Ager, and I didn't mean to cut you off by like 15 years. I do apologize. Mr. Lara, and just again, we're going to look for 30, 45-second answers just because we have so many folks. Mr. Lara.
So, trust me, this is not only affecting SB 562, but it's affecting our entire budget. And so, we've been working on this. We know the governor, we did some minor work on this. But I'm going to dovetail to actually Deborah, who can, kind of highlight more of the impacts. The fact is that under the retiree pension benefits that we have, it would get rolled over into the system as what we would have any other of the liabilities that we have. The liabilities get rolled into the single payer system, which would then allow us to continue to negotiate a better price and be able to begin to start paying off some of that debt. That's the way I understand it. And Deborah, I don't know if you want to dovetail on that.
Exactly. There's actually quite a bit of savings in not only one having to negotiate with the counties for public employees benefits, because that will already be taken care of. The employers and the counties that have been contributing to the retiree healthcare pension plans won't necessarily get off scot-free, because they will be paying up the payroll tax, right? And the businesses that make a profit, because they've now then been lifted off of the burden of providing health care coverage, will be paying the gross revenue tax. And then there was one other point that got kind of lost in this with mental health care. Mental health care coverage and having parity and coverage for our patients will actually decrease the population in our county jails and save money that way as well.
Thank you so much. Let's go to, real quick, Dr. Colfax.
Thank you for the question. As somebody who administers the public health, behavioral health, and social service side in a local county, I would say that Medicare for All would be a huge step forward with regard to cost, because right now we're looking at increasing county responsibility for cost, right? So constantly with my budget with the board, we're asking questions like the in-home support services. There's a huge cut coming forward in the state potentially with regard to in-home support services. The burden is falling back on the local counties. So Medicare for All is a huge step forward in making sure that as a state, we are responsible for the care of all citizens rather than increasing the fragmented system of having each local county trying to figure out the system and working with very limited resources. So it's a huge step forward from an administration standpoint at the county level.
Thank you so much, Dr. Colfax. I'd like to be able to go back. Any specific questions for Mr. Lark? Please, three gentlemen, please come forward. And I want to get the gentleman who's in the orange shirt. What's your name, sir? Dale
Axelrod.
Dale, you are amazing, and thank you so much for allowing folks to come forward, and I apologize. Please, sir, 30 seconds.
Oh, I had a question. I think Jerry Brown's, his question was how it's going to be paid for. And Ricardo Lara, you mentioned that you're going to be giving that information, or there's a plan to give that information to the assembly members. What is that plan so that Mark Levine can start reading the study?
No, the plan's already been out. The plan has been out for a couple,
but you mentioned there's a plan to have them, to inform them of this information. You said they haven't gotten the information earlier. You mentioned that you haven't given them the information.
The financial plan is out already.
So it's out and it's available for them to read.
Correct, yes.
And I read that in the San Jose Mercury News before it was even passed. It was already out in the San Jose Mercury News where they reported the information about the study, even before you guys passed it.
Right. Well, the study came out right before we voted for it in the Senate.
Okay.
And so the plan was then to now,
And the assembly members are gonna. There's a plan for them to actually read it then.
Well, this is one of the plans.
One of the plans.
We want to make sure that
right.
we allow for the public to consume it, to digest it, have experts, economists look at it, be able to, ensure that the numbers that we're providing are correct, because we feel we're very confident in our study. But again, this is one financial plan that in the entire process, we want to make sure we engage everybody and then engage the governor and engage the assembly on what are some of the issues that they care about and figure out how we, amend our financial plan. This is just part of the legislative cycle. So we put our plan in place now. There's one financial study. The plan is to see what are some of the issues now that the assembly and the governor care about. So this is an ongoing conversation.
All right, Dale.
I just want to thank all of you guys for doing this.
Thank you, Dale.
And I just want to say that if you guys pass it, this is going to be the first state in the United States to do this. So I think all of you will have your names in textbooks. And a lot of people don't want to be politicians, but this is probably one of the reasons that you can't, that people want to be a politician. That, your names will be in history if you do it.
Thank you very much, Dale. Thank you for being here. I'm grateful. Sir, we welcome you. First name in 30 seconds, sir, and thank you for your patience.
Yeah, good morning. Thanks for all this. Ron Freshman. I understand that this is just a fundamental thing to have universal health care. But underlying this is the inequality in our society. And we have to find a way to pay for this until we can do it right. Correct. So my question is, I know in these reports they've looked at the gross revenue tax. And for years, our politicians have been favoring and looking at corporations and the wealthy, and they've been chipping away at our tax code. So my question is, can we not use that gross revenue tax to do the thing right, to straighten out the inequality and to be able to have corporations step up and pay their fair share? Can we do that?
Absolutely. We're open to having all the discussions. I mean, I think Deborah and I are not set in stone in the way we fund this. We know this is one option that we're putting out there, but this is one that we continue to have dialogue on and looking at what the corporations are paying now. The fact is, under our plan, the largest corporations, actually, we increase what they have to pay, but they actually still save money, given the fact of how much they're actually paying for their employees now. So we've, I think, been very creative with how we fund this. The last thing we want to do, and I want to be very unequivocal about this, we want to be very careful on how we fund this. We want to make sure that this is sustainable and that it has the appropriate cost control measures. So it's something that we're going to leave for future generations. We do not want to be able to just do something fly by night just because we want to get this done. We want to get this done right. And our study demonstrates that we can get there, we can save money. Corporations, the biggest corporations will pay a little higher, but still end up paying less in the long run. So this is our idea, this is what we think works, but we're open to having multiple discussions.
All right, thank you so much. Thank you very much. We're going to go to our last question for Senator Lara. Then we're going to turn it over to Dale, who's been very patient, and all of you. Please, sir, 30 seconds.
Yes, my question for Senator Lara, what is the status of any, if any, of your conversations or discussions with Speaker Rendon?
So Speaker Rendon and I are scheduled to have a meeting in the next 2 weeks to get his perspective on what he feels we need to do to move forward. He's the member of the assembly in my district, so I know where he lives, I know where he eats, and I know where I can find him. So, and he's, we're gonna have a good conversation, and look forward to getting his idea on how we can move forward. I know he says he's supportive of a single-payer system, so we want to make sure that we have a conversation. He's always been a man of his word, and we're going to have that conversation and see what his ideas are. So thank you for that question.
Thank you so much. We're going to, all the folks who are currently in line right now, we're going to have you speak. We're not going to have anyone else, if you don't mind, just because we're coming up short on time. Senator Lara is going to have to catch a flight, but if it works for folks, Senator Lara, any closing remarks that you'd like to be able to give?
Just take a second. Thank you for making me feel at home in Marin. You guys inspire me to go back and continue the fight. And I just want to be very clear and thank all of you. I know I'm the new kid on the block fighting for universal health care. I am standing on shoulders of giants that have worked on this for 20 plus, 30 plus years. Know that in me, you have a champion, somebody that really has lived the experience of not having health care. I'm not giving up. You look at my legislative agenda, we have taken on juggernaut issues. We're not going to let this one go. We are on the right side of history. This is the right thing to do now more than ever when the federal government continues to annihilate our health care. We have to stand as Californians and prove that we are leaders, we are the visionaries, we are California, and we lead. Thank you for your support. Thank you.
Thank you very much, Senator. Very grateful. Thank you for joining. Thank you. All right, we're going to come right back to Dale. Dale, thank you so much for allowing folks to be able to go forward. Just because he has been so generous, we're going to give him some extra time here to be able to ask your question. Thank you.
Great.
Please, go right ahead, sir.
Thank you. Now that we're on the subject of Speaker Rendon, I'm with the Sonoma County Democratic Party. We strongly support 562, and we sent out a statement to every central committee in California to urge their assembly members to sign on to this statement. And I'm very happy to provide the opportunity for Assembly Member Levine to possibly be the first person, assembly member, to sign on to this statement, and I'll be very quick. Dear Assembly Speaker Rendon, we believe that passage of Medicare for All, the Healthy California Act, will be seen as the true turning point in 2017 for the Democratic Party all across the U.S. SB 562 needs to be pulled out of the Rules Committee and worked on immediately. Unresolved issues need to be debated, amendments adopted, and then it needs to be passed. Now is the time to advance single-payer health care for California. Let us show the country how it's done.
Thank you very much. Assembly member.
Yeah, thanks, Dale. I really appreciate that. The Speaker has heard from all 55 members of the caucus on this issue, and he's heard from me personally. And I think it's a conversation that Senator McGuire and I had last night about this bill, is that the work continues on this bill. That's happening right here, but amendments can be proposed for this bill. We can hammer out issues on this bill, and that has not ended. And so we are committed, and that's why, Senator McGuire and I decided to do this forum before the bill was held by the Speaker, and that didn't stop us from wanting to continue working on it. And so we're committed to doing that. Thank you.
No, thank you, Dale.
I just want to remind people that it took almost 4 years by some accounts for the Affordable Care Act to be rolled out. We can't afford a delay on this.
We're going to need to keep moving. Deborah, real quick.
Okay, so there is a People's Health Committee meeting in Sacramento, 12 noon in front of the Capitol. Sacramento People's Health Committee will be talking about the health care bill.
Yeah, and I think also to that point, there is a select
Tuesday.
committee on this issue, co-chaired by two doctors in the Assembly, Dr. Joaquin Arambula and Dr. Jim Wood, who's the chair of the Assembly Health Committee as well. So we have a select committee where we're also hearing this issue.
Thank you very much. And I think it also is important to note, as I said in the beginning, the Assemblyman is the only member of the Assembly that are even willing to be able to step out and do town halls on this important issue. So thank you very much, sir. We welcome you.
Thank you. My name is Frank Shinneman from Sausalito.
Let's see, Frank.
Thank you for holding this town hall meeting, and thank you for your good words. The good words, though, are spoken to the choir and are not enough. We're in the midst of a national emergency. Voting good words and standard legislative protocol is just not enough. Some have referred to SB 562 as a 2-year bill. We need you to work together to make this a bill that is taken out of Speaker Rendon's hands and moved ahead this year. We don't need to know why it can't be done. Thank you.
Frank, thank you so much for your patience, and thank you for hanging with us. Doctor, welcome. We're grateful that you're here.
Hi, I'm Dr. Lossie, and I'm a doctor who's been working on the front lines in community health centers for more than 20 years. And I am here to talk about two parts. One is what it's like to deal with somebody whose arm is swollen to twice its size and wants me to tell them whether it's worth it for her to spend $600 to get an ultrasound to figure out what it is when she just thinks maybe she slept on it wrong. That just sucks. And then the other part is fighting for people to be able to get their blood sugar test strips covered by Medicaid, have to fill out I don't know how many forms to get those things filled out. So my question is, how will we be sure to cut out the middlemen in the insurance industry? A lot of previous single-payer bills have included allowing insurance companies to oversee the way that this is run. And so I just want to make sure that I'm not going to have to fight with them to get the blood tests.
Why don't we go over, so let's go to Ms. Berger in regards to the middlemen and how to be able to cut those folks out. Dr. Colfax or Dr. Flinders, I don't know if you want to comment on this as well. Ms. Berger.
The healthcare industry is out of the picture as far as deciding how you provide care for your patient. They will no longer be providing insurance. We will be in the health care business, not the health insurance business. So no more papers, deductibles, approvals. Your clinical judgment is what the patient gets.
Thank you so much. Dr. Colfax, did you want to chime in on this one? Dr. Flinders? All right, the two doctors are going to get together. I heard coffee, but maybe margaritas. So see, there we go. Watch out. Sir, we welcome you. 30 seconds, and I just want to say thank you for your patience.
My name is Dr. Eliezer Margolis, and I want to address the issue of political will, so I'm looking right over here. I'm sorry that Senator Lara is gone. Our political system is even in worse shape than our healthcare system, if you can believe that. And the whole notion of Democrats means nothing to everyone who wants universal health care. We have a corrupt Democratic Party holding Kimberly Ellis at bay. We have problems with the Speaker, Anthony Rendon. So being Democrat doesn't mean anything. It's where people stand on the issue. And I'm wondering if the two of you are going to be willing to spearhead an issue for every member of the Assembly to disclose the amount of money that they receive from large insurance and from healthcare corporations.
So very quickly on the campaign donation information, that is available online, and that is at the Secretary of State's website that can be searched. I think the other point that you made is kind of how we work together as lawmakers. And I think as you can see, we've got great relationships up here going all the way from our county supervisor, President Arnold, to Senator Lara and Senator McGuire. Between the two houses, the three of us have good relationships. I consider them both friends and can communicate about issues, even if we disagree, even if we come out on a different side of a vote, that those relationships remain strong. And I want to talk about Senator McGuire a little bit. When I need help on something, he tries to find a way to be there, and vice versa. And we often have bills. We do bills in the House of Origin. I'm an assembly member. The first house the bill goes through is the Assembly, and I would then present my own bill on the floor of the Assembly. It then goes to the next house. So someone else has to present it in the other house on the floor of the Senate. And often I'm going to be looking to Senator McGuire to help me out as he does with me. And I think you heard a little bit about the importance of that relationship earlier when Senator Lara talked about how Speaker Rendon's district is nested partially within also Senator Lara's district, and how important those relationships, that you have communication, that you're able to talk to each other about bills that are important, that you can work together and flesh those things out before an issue like this bubbles the way that it does. And I'm really grateful to have the relationship I do with Senator McGuire, where we haven't had that problem. And we all have to work on those things. And so I think that's a lesson and I think that Senator Lara mentioned it, he and Speaker Rendon will be getting together shortly. And I think that's going to help a great deal in helping this progress more than it has.
Doctor, I think that I'm going to be very quick on this, and just because we want to make sure, number one, the Assemblyman and I talk a few times a week. It's really important that we are coordinating on several important issues. What I'll share with you is we talked as late last night on all issues in regards to health care. Look, I think
What about the corrupting influence of money in the political process? I'm not hearing a response about that.
Look, I'm all for public financing of campaigns. I mean, that's where we need to ultimately go here in California. And then the Assemblyman is the author of the Disclose Act to be able to start disclosing some of these wealthy donors. It is absolutely obscene what we've seen with Citizens United and what we continue to see here in the state of California, the control that big business has. If we are going to be the party of working people in this state, we have to walk the walk, right? And that's why I think that we are here today. The fight for health care is the fight of our lifetime. And we have to make sure that we are providing resources to be able to get 562 passed. The best way to be able to do that, we have to kickstart this conversation. It starts here today. I will share with you, as working with Senator Lara and Assemblymember Levine, we need to be able to get this bill back up and running. The best way to be able to hammer out the finances of this bill is to have a bill and to be able to hammer it out. I will tell you, the Assembly member is committed to be able to work in those details on all issues in regards to that. I don't mean to have to move forward because we have our next. I'm grateful that you're here, and I also want to say thank you for your patience. Welcome, sir, to the next one. Thank you so much for being here, sir. It's good to see you again.
Good to see you, too. My name is Lawrence Lewin. I'm an immigrant from Orange County.
Hey.
For 50 years, I practiced nephrology in a very unpleasant, unwelcoming environment. In nephrology, we have universal health care. It begins with the first dialysis treatment. It costs $75,000 a year for those patients on dialysis. And there are industries, companies like DaVita and Fresenius, that like it just that way.
Lauren, I don't mean to, I'm just going to have you make sure, I want to, just because we have other folks behind, I just want to make sure you hit the point. So please, Lauren, I don't mean to interrupt.
Okay.
I apologize.
Okay, my point is on the financial cost of health care. Yeah. By having single payer available, the diabetics whom I see with end-stage renal disease and who have universal care could be prevented from the need for that care if they could receive treatment early in the course of their disease. I volunteer at Marin Community Clinic.
Thank you.
I see those patients. We need access to health care for everyone at an early stage, and I guarantee it will save money.
Lauren,
I want to
thank you.
thank you all. I have to thank the nurses for shining a light on medical ethics.
Lauren, thank you. We're going to have to move on, and I
Thank
apologize.
you.
Thank you so much. Mr. Colfax, you want to jump in on this?
Yeah, I'm glad that the doctor brought this up because his point reinforces the fact that our current medical system, the incentives are perverse, right? Clinicians get paid more to do more things rather than the right thing, right? More stuff, more expense. It's not necessarily the right thing. Chronic kidney disease is a largely preventable disease. If we had a universal system where people could get into care, get the meds they need, and be controlled, we would see end-stage renal disease drop dramatically in this country. Better for the patient, better for cost. So universal health care will change those incentives, focus more on the patient, more on prevention, more on holistic care, rather than going to third end-stage care where the costs are astronomical.
Thank you so much, Dr. Colfax. Sir, thank you for your patience. I'm so sorry to keep you waiting. We welcome you 30 seconds, sir.
Okay, my name is Bob Jung. I'm with the Santa Clara County Single Payer Healthcare Coalition. We've been working really hard on
Thank
this
you for
issue.
making the drive.
A lot of us drove up here today. Thank you for
you.
this forum. Get your counterparts to have more of these forums across California because you can see the reception's great. Now, my question is, we've got like 3 days, and people should be calling Rendon. I've got phone numbers, email, Twitter, Facebook if you need it. We've got 3 days for this before it becomes a 2-year bill. Now, my question is, assuming Rendon gets his way and forces it to be a 2-year bill, we need to make this a 2018 issue. We need, especially in the primaries for the corporate Democrats that you keep talking about. So we need to get people on record saying they're not going to take any money from the healthcare industry, from the insurance companies. We need to go on offensive, not wait for the corporate money to come in and be on a defensive. So what is CNA? What is the Alliance for Retired Folks? What is the Progressive Caucus? What are we doing? When are we starting this offensive?
Thank you so much, Bob. So I think that, and I don't want to speak for folks, but first of all, thank you so much for making the drive up. Really grateful. Number two, I don't think that the push has stopped since the decision was to be able to hold the bill. There have been intense discussions between both the Senate and the Assembly on this issue, I guarantee you, and it is going to only become more intense if later in the year, if this is ultimately going to become a part of the 2018 session. This issue is not going away. It's not going away for two major reasons. Number one, the federal government, the decisions that they're about to make will make America sick. And that means the destiny is in our hands. And I'm going to use the line that Mr. Lara did. We have to be on the right side of history on this issue. We have to make sure that Californians, the 3.2 million that are now currently covered under the ACA, are going to be able to get quality health care close to home. And the only way to be able to do that is through universal health care here in California. So I guarantee you it is going to become probably the top issue in Sacramento. Mr. Assemblyman, any items?
Yeah, well, I completely agree with Senator McGuire. I think the other thing is to recognize that this bill, if we're going to look at SB 562 specifically, it will almost by nature necessitate a 2/3 vote. And so the fiscal bill deadline is almost not an issue because we can change, if the senator wants to, the bill to an urgency bill, which means that the deadline does not apply to it. When you make a bill an urgency bill, it does two things. If the bill is passed into law and signed by the governor, it becomes law immediately. It doesn't wait until January. The other one is, of course, it requires 2/3 because of the cost of raising revenue. And so this bill is not, I don't think it's, this is very technical, but may not be governed by this fiscal deadline because of the opportunity to apply this urgency clause to it, which it would need anyway because of the fiscal cost.
Thank you so much. And again, thank you for making the drive. Sir, I really appreciate you hanging with us, and I'm sorry about the delay, 30 seconds. And again, so sorry about having you wait.
Sorry.
Yeah, you're good.
My name is Brian Dane. I'm a special education classroom aide, and one of the reasons I support this is it's not just about healthcare, it's about affects other things. We spend so much money on our health and welfare that could be going towards our classroom classrooms, which are so cash-strapped enough as it is. Also, as a millennial, I heard, where are the millennials? One of the reasons I think is outreach. I'm a union member, California School Employees Association. I know that they're a part of Healthy California. They've endorsed it. I know the nurses have taken the lead big time. And I wanted to ask Ms. Berger, first of all, thank you for the nurses' support and what you do, even beyond healthcare. But what are your thoughts on other unions and what they've been doing with SB 562 thus far? I go to our conference in a few weeks to speak as a delegate, and I wanted to just get your opinion.
And Ms. Berger, you're going to have it 30 seconds or less.
Okay.
Please, thank you.
So there's good players and bad players both in the legislature and in unions. And unfortunately, there's one union that tends to want to hope for a better vehicle. And we're just going to leave them alone, and we're going to continue to put forward SB 562 because we believe that that is the way to get health care for all. We're continuing to work with the legislature. On Tuesday, July 11th, we're having a People's Health Care Committee where we will be hearing it at 12 noon on the steps of the Capitol to put pressure on Assemblyperson Rendon to release the bill because we know it can be done.
Thank you so much. Let's go to our next speaker. And again, thank you for your patience and for hanging with us today. Welcome.
Hi, thank you. My name is Sue Cannon. I'm a registered nurse. I'm from Petaluma. I work in a neuro ICU at UCSF. I have seen patients, because they didn't have blood pressure medicine, a cheap medicine, come to me with strokes, bleeds in their heads, and it's devastating then for the future for them. I was all excited back when Sheila Kuehl was working on healthcare for all, universal healthcare. And it broke my heart that you guys weren't able to do it. So I'm asking you, do not break my heart this time. I really want to know who is going to be the governor that signs that kind of a bill. I don't know, Jerry Brown may not, I don't even know if he would even really sign one if it came to his desk. But when the bill comes to a governor's desk, who is going to be the governor that I should vote for that's going to sign that bill?
Thank you very much. I don't know the answer to that. I don't know if we know of any gubernatorial candidates who have supported single payer.
So Gavin Newsom was on stage at the Democratic Convention at the end of the day working with the ADEMs, and he said he supports SB 562. But as you all know, what makes the politicians have the political will is us standing behind them and pressuring them to do the right thing. So they know who elects them, they know where they get their support, and yes, a corporation can give them money, but we are the only people that can give them our vote. So we need to make sure that we support people that stand up and do the right thing. It was not an easy thing for Senator Hernandez to chair the Health Committee and get it through the Senate. So we need to support people that will support single payer.
Thank you so much, Ms. Berger. Thank you. Thank you very much for being here. Our next speaker, and just want to say, sir, thank you for hanging with us and for your patience.
Good afternoon. My name is Steve from San Rafael. My understanding is that one of the primary costs in the medical system is our fee-for-service model. And so this bill seems to address the insurance side, but not the provider side. And by extending coverage to all services for everyone, it seems like there's potential for very high costs. I don't want this to fail because of that. I want universal health care. So I guess what I'd like to know is there contemplation of changing the fee-for-service model to maybe based on outcomes or something, and how we can make sure this is sustainable?
Steve, great question. I'm going to go to Ms. Berger.
Okay, it's actually a myth that fee-for-service increases costs. If you look at Japan, they see doctors 3 times more than we do, and they pay less in medical care. In Canada, they see the doctors twice as often as we do and pay less in medical care. Where the costs come in is having to order the test 3 or 4 times to satisfy the requirements for an insurance company to prove that you need that treatment. What costs more is having barriers to health care so that when you need to see your doctor, you have to go through an advice nurse, you have to go to the emergency room. So there are cost efficiencies, and it's not because...
Well, we all know about hospitals like the itemized bills where you get charged like $500 for an aspirin, that type of thing. I mean, that's all part of that fee-for-service model. But
thank you very much, Ms. Berger. Mr. Flinders, any items you want to talk about on that one as well? Berger's all over it. I like it. Thank you so much.
Just because physician visits go up in single payer.
Going to have you go right up to the microphone. You need to go to the microphone.
There are several examples, and she mentioned Japan and Canada, where the actual physician visits are more frequent in these single payer systems, and yet physician costs are fewer. And that's not a fee-for-service system.
Thank you very much. And again, panelists, I'm not trying to cut you off. I do apologize. Just want to make sure. So want to remind folks, we just have 2 more speakers. Please welcome, ma'am.
Thank you so much for being here. Let's do more of this. I'm interested in knowing how Prop 98 figures in this whole scenario and what you plan to do about that, either exempt 562 or amend 98.
It's a great question. That's one of the reasons why this will most likely need to go to the ballot, because it's going to mean a constitutional amendment. So right now, Prop 98 guarantees that 48% of the state budget is spent on public education. Number one, we're going to need to be able to potentially amend that. Number 2, we're most likely going to need to raise the GAN limit about how much we could spend on an annual basis.
So what's the likelihood of actually pushing any of those through? I mean, is that pretty good?
It's going to take some work, right?
Yeah.
And it's going to take some teamwork and collaboration, which is why we need to be coming together now to be able to move this forward onto the ballot as well. I don't mean to punt. I think it's my own editorial is it's going to take some work. But here's the deal. In order to have a successful economy, we have to have successful public schools and a thriving healthcare system. And I think that we're going to need to be able to accomplish both, which means there's going to have to be collaboration and compromise as we move forward on these potential constitutional amendments. Assembly member, anything you want to?
Yeah, well, I think you're raising extraordinarily important political challenges that conversations like these help to inform the electorate as to what is it that we're attempting to do with universal health care in California. Once people understand what universal health care means, single payer is a very technical term, and I think that's lost on folks, that will help inform a future ballot initiative to say, if we want to provide for true universal health care for all Californians, that it's important enough to do it in a way that is separate and distinct from other revenue that the state of California raises, which is subject to Prop 98. And that it is also important to recognize that we need to raise how much money the state can spend. And so, people debate about how much a true universal health care system in California would cost, but it is far more than double or perhaps triple the current state general fund. This is part of that public conversation to raise awareness among all Californians.
Education, education, education.
That's
Thank
right.
you so much.
Thank you so much. Thank you. I know Supervisor Arnold has a meeting here coming up. Supervisor Arnold, do you want to make a couple of closing comments? And then we're going to go to our last speaker, and thank you for your patience.
Thank you is it on? Oh, thank you very much, Senator McGuire and Assemblymember Levine, for providing this. This was a great forum, and it should give everyone hope that if we all band together, we can get this done. And please know that the Board of Supervisors is behind this bill, going to work hard to get it passed, and as supervisors, we're going to contact our cities. Novato has 11 cities in the 5th district, and we're going to call on those cities. Not Novato is one of them, but Marin County is comprised of 11 cities plus unincorporated. Those city councils need to know about this bill. We need to do an education for them so that we get them to put pressure on Sacramento. So please remember that. Thank you again. Thank you to our panelists. I'll see you.
Ladies and gentlemen, the President of the Marin County Board of Supervisors, Judy Arnold. Give her a round of applause. Thank you so much. Thank you. And we are so grateful that you are hanging with us. Give us your name, and thank you for your patience.
Yeah. Thank you. My name is Karen Berg-Smith. I live in Larkspur. I'm a mental health professional and also a mother. And in looking around, I was also wondering where my peers are. I'm not a millennial, I'm a baby boomer, I'm 53, and everyone is out enjoying a nice afternoon. So I want to speak to a comment and also a question about how to involve a younger generation. My husband and I are self-employed. We pay $18,000 a year for our health insurance, which is a bronze plan. We get very poor coverage for that. It's a very restricted panel. When I have a healthcare issue, I go to Good Earth, and I buy good food, and I go to yoga, I pursue acupuncture, and I pursue naturopathic medicine. That is what is often interesting, especially in Marin County, to people of my age. And the Affordable Care Act was supposed to cover complementary medicine, and it's very hard to access on that plan. And so I'm curious about, as a way of, I think cost is a way to get people of my age involved, but I think also to appeal to where are people going for their health care. If I am in a car accident, I will go see an MD and be very happy, but I also want to have complementary medicine. So is that part of the bill? And that would be very interesting for people of my generation.
That's great. Why don't we go to Ms. Berger, and then we'll check in with Mr. Flinders as well.
Short answer is yes, complementary medicine is part of the bill. It's the clinicians that will work with all of the other providers, because there are other modalities that work well as an integrated system. Nurses know about holistic treatment, and it is included.
Dr. Flinders, and we'll see Dr. Colfax.
All I can add to that is that the largest single-payer systems are able to include a better array of complementary and alternative services than ours currently do. Kaiser actually does a very good job if you look at them and what they make available. But it appears that the larger the system, the more available these complementary kinds of alternatives are available. And you can confirm that in Japan, France, Great Britain, Taiwan, Canada. So I don't think you have anything to worry about. I admire your patience to stand here for an hour to ask your question. That's the kind of patience and hard work we're all going to need to educate the public about what's really going on.
Thank you very much, Doctor. Dr. Colfax.
Thank you for your comments. And I think the key thing is telling your stories. You were very effective in telling us how your family is burdened as small business owners paying $18,000 a year for insurance. Imagine what would happen with universal health care, with Medicare for all. That would go away. So I think talking to your peers, having those conversations in your neighborhood, and having the perseverance to do what is right will be key, both at the state level and here in Marin County, where universal health care will have a huge effect. So thank you.
Thank you so much. I just want to say thank you, all of you, for hanging with us today, particularly at 12:45. We're about 45 minutes late from our original adjourned time. And I think we need to give a round of applause to all of our panelists. Come on now, my goodness. And I think we need to say thank you to all of you for your incredible fight and for your advocacy. I'll have a few closing comments, but I want to turn it over to Assemblymember Mark Levine.
Thank you, Senator McGuire, and thank you for, again, really amazing job emceeing this, and our panelists and everyone who stayed on a hot morning to show how much you care about this issue. We cannot do our job without hearing from you. And it's been incredibly meaningful to me and informative to me to be able to take what you've said and go back to the Assembly and go back to the legislature and fight for you. We are going to do what we can to make sure that all Californians are protected from Congress and the president taking health care away. We're dedicated to that. And we're going to continue working on this issue. This forum ends, but that doesn't mean that the work doesn't continue. It continues. And thank you for being here with us for that fight.
Thank you very much, Assemblyman. A few other thank yous. Just want to say again, thank you so much to Dr. Grant Colfax, who is your lead health officer and public health director of Health and Human Services in the County of Marin. Dr. Flinders, who is amazing, has been such a resource throughout this. Deborah Berger from the California Nurses Association for all of her incredible work. We want to say thank you so much to Ms. Reed as well for her amazing advocacy on behalf of seniors. Al in Good Earth Markets, my goodness, thank you so so much for your fantastic work. Again, a round of applause for our panelists. Thank you so much for taking the time. Another big thank you to Assemblymember Mark Levine's team and the entire team that I work with every day, in particular Carlene Rebich, who has been working her tail off and making sure everything is smooth today. And finally, I just want to say this. The fight starts here again, right? We cannot afford to allow this bill to simply sit idle. We're going to be working together, State Senate and the State Assembly, to be able to address this issue. Again, the right to health care is the fight of our lifetime. And we look forward to being with you month after month to ensure that we're going to be able to pass universal health care here in California. Thank you so much, everybody. Thank you for joining us. And thank you for your incredible input. And thank you for hanging with us. Big thank you to Senate Special Services and everything they've been doing for our live stream, and our amazing sergeants as well from the Senate. And a round of applause to the California Highway Patrol. Thank you so much. And thank you to Redwood High School for hosting us here today. Thank you very much.